Hello, and welcome to the 2025 Health Center Workforce Summit. We're so excited that you decided to join us here today and over the next couple of days to be able to engage with one another and with your colleagues whose best practices and promising practices we'll be highlighting over the course of the next 2 days. My name is Gerard Jolly. I'm the Director of Career Advancement Strategies with the National Association of Community Health Centers, or NAC. And for those of you who may not be familiar with us, we're a national organization that since 1971 has been working to support you, the health center workforce, your health center organizations, and similar look-alike organizations to continue to expand access to healthcare. I'm excited to be able to bring this session with you in collaboration with our friends and colleagues from the Association of Clinicians for the Underserved and the Community Health Center, Inc., Moses Weissman Health Center. I'm going to invite my colleagues from those organizations to introduce themselves at this time.
Welcome, everyone. My name is Michelle Fernandez Gabilondo. I am with the Association of Clinicians for the Underserved. I'm the Director of Workforce Development, specifically with the STAR Center program, and that is solutions training and assistance for recruitment and retention. So ACU was started a little bit over 25 years ago by National Health Service Corps alumni. We have a variety of different programming. The one that brings us here today is the STAR Center. So we are one of 22 NTAPs along with NAC and CHC Inc. Our focus is on supporting community health centers with their workforce recruitment and retention needs. You're going to see several people from ACU throughout our time here, and in a little bit we will have our executive director giving some opening remarks, but very excited to have everyone joining us. I think it's going to be an amazing 2 days, and I'm going to go ahead and pass it over to Megan.
Awesome. Thank you, Michelle, and good morning and good afternoon, everyone, and welcome to the 2025 Workforce Summit. We're so glad you were able to join us here today. My name is Megan Angers. I'm the Senior Program Manager with the NTAP on Clinical Workforce Development at Community Health Center, Inc. Community Health Center, Inc. is a federally funded health center in Connecticut. We were founded in 1972, and now we're an affiliate as well with the Moses Weissman Health System. You may have seen us around through our NTAP, which was funded back in 2015 to focus again on clinical workforce development, including transforming teams and training the next generation. You may also know us from our Weissman Institute as well. But again, thank you all for taking the time to join us today, and hopefully this summit will inspire you with innovations and best practices. With that, I'm going to go ahead and share some housekeeping notes to ensure we're all on the same page and we can provide you with a smooth and engaging experience. So first is a reminder that your microphones and cameras are disabled for this webinar. We welcome you to join flexibly, so join us whenever your schedule permits or allows you to. You are welcome to leave and rejoin at any time throughout this Workforce Summit throughout the 2 days. The webinar link will remain the same throughout. So again, join as you are available. We also want to hear from you, so ask questions. We encourage your participation. The Q&A feature is in the toolbar at the bottom of your Zoom screen, and you are welcome to submit questions whenever you have them. Our speakers are here to engage in that dialogue with you, and they're so excited to share their insights and answer your questions. At the end of each session, we will have that designated Q&A time, but again, you can submit them whenever you have them. For breakout groups, please note that you will need to switch Zoom links, so you'll be joining a Zoom meeting and then put into a Zoom breakout room. We will have further instructions on that once we get to our breakout groups today. And then after the end of each session, an evaluation will pop up on your screen through a Zoom poll. We welcome you to complete that after each session as well as at the end of the day, and we truly appreciate your feedback. And then finally, follow-up materials, your slides and recordings of the Workforce Summit will be emailed to all registrants 1 week after the event concludes. Again, thank you all for joining us and looking forward to a productive and inspiring day together. I'm going to pass it off to Gerard to provide an overview of our goals and agenda.
I think you're
Gerard,
muted.
you're on mute.
I was just talking to myself for a moment there. Again, thank you, Michelle and Megan. So what do we have in store for you for the next couple of days? Our theme of the Workforce Summit is building a workforce for 2025 and beyond. And this is an opportunity for you to gather with your colleagues and with your partners to be able to share and elevate the various best practices, the promising work that you're doing to address workforce challenges and needs. We're going to be focusing on improving workforce well-being, supporting recruitment and retention, enhancing and implementing sustainable workforce pathways that will look to train the next generation of health center professionals, and strengthen emergency preparedness with you, the workforce, in mind. We're going to have a variety of different types of presentations, breakout groups, and large group discussions that'll allow you to be able to really focus in on innovative workforce models and practices as you build community and leverage resources to support you in developing successful workforce strategies. You can find the full agenda. I believe it was emailed to each of you earlier this morning as well. Let's look at an overview of our agenda for today and tomorrow. We're having our welcome and opening remarks now. We're excited to follow this session with our HRSA Keynote, where we'll be able to have our HRSA headliners from 3 key HRSA bureaus. So we'll look forward to that momentarily. We'll have a session on workforce well-being promising practices. And then after that session, we'll spend some time allowing you to be able to break out in groups to discuss those promising practices and the work that you're doing within your own organization. Later this afternoon, we'll look at technology, AI in health centers, and how that supports the workforce, and really delve in to the critically significant way that health centers are and can utilize artificial intelligence. And then we'll look at our dental training programs at health centers and ways that you are expanding access through dental training programs. And then for day 2, we'll look at leadership and mid-level management training. We'll look at an example of work that a health center is doing in that space that we anticipate you'll be able to take some things away from it in terms of what you're doing in your organization as well. We'll spend some time after that session in a breakout group, again, allowing you to engage and interact with one another, share promising practices, and address perhaps challenges that you might be facing when it comes to leadership and mid-level management training. Then certainly intergenerational communication with multiple generations in the workforce today is something that takes skill to navigate. And so we'll address how you can enhance that effective communication among the various generations within your organization. Later that afternoon, we'll address various training programs, how you can build training programs in health centers, and as we mentioned earlier, how we can strengthen emergency preparedness for you, the workforce, as well. So we're excited for what we have over the next session, over the next couple of days, and I feel like I've said excited about 6 times since we started this summit. So I'm really excited. With that, we're gonna thank some folks without whom we couldn't have put this summit together. I believe I'll turn that over to you, Megan.
Yep. Thanks, Gerard. So yes, thank you so much to those that participated on our Workforce Summit Advisory Group. Our 14 advisory group members represented community health centers, primary care associations, health center control networks, federal partners, and more of our partners as well. Their engagement and enthusiasm and dedication for planning a robust agenda was inspiring, and we thank all of our advisory group members.
So I also want to extend a huge thank you to the Workforce Summit planning team. Really, it's just these amazing colleagues at CHC Inc. and NAC that the Star Center and ACU got the chance to work with. I do want to extend a very heartfelt thank you to my fellow colleagues at the Star Center, Mariah Blake, who's our Associate Director of Workforce Operations and Compliance, and Sydney Axelrod, our Associate Director of Workforce Development, who will be speaking, so you'll see her on on day 2. So just such an honor to get to work with both of them. For Community Health Center Inc., the same, getting to work with Megan Ingers, the Senior Program Manager. You all will hear a lot from her throughout the next 2 days, and Bianca Flowers, the Project Manager at CHC Inc. And then we also have our wonderful colleagues over at NAC, or the National Association of Community Health Centers. So Gerard Jolly, Director of Career Advancement Strategy, same, you will hear a lot from him as well. I feel like the 3 of us may be the ones that you'll hear throughout. Katja Lepke, Director of Clinical Trainings and Workforce, Megan Ward, Manager, Leadership, Workforce and Career Development, Pamela Ferguson, Manager of Clinical Workforce, and Sarah Price, Director of Public Health Integration. So just thank you to the amazing planning team. It's really been an honor to get to work with all of you. And as everybody has said, we are super excited. So we are ready to get this going. Just as important, and a huge, huge thank you to our federal partners at HRSA. In a moment, you will be hearing from them, but of course, the Bureau of Primary Healthcare, the Bureau of Health Workforce, all of the individuals that we work with at HRSA. So thank you so much for all of your support and for being here today. Okay, so we are about to get started with our opening remarks. So we are just going to very quickly introduce the 3 speakers that you will be hearing from. So you will have Amanda Pierce-Kelly, who is the Executive Director here at ACU, or the Association of Clinicians for the Underserved. And Megan and Gerard, I'll pass it over to you to introduce Margaret and Dr. Padilla.
Great. Thanks, Michelle. Yep. And you'll hear from Margaret Flinner, the Senior Vice President and Clinical Director of Community Health Center, Inc., and the Moses Weitzman Health System, as well as the co-principal investigator of the NTAP on clinical workforce development.
And you'll get to hear from Dr. Luis Padilla. He's the Chief Health Officer here at the National Association of Community Health Centers. And I'm sure many of you know him from his most recent former gig as the Associate Administrator for the Bureau of Health Workforce at HRSA. So we look forward to hearing opening remarks from all of our key leaders. I think we'll turn it over to Amanda.
Okay, I was just gonna say, is that my cue? Really, really wonderful opening. And again, I just want to start with a huge thanks to all of you and the advisory council, and honestly, the full team in each of the 3 organizations that have put together just an incredible program for the next couple of days. So I am Amanda Pierce-Kelly. I'm the Chief Executive Officer of ACU. You heard Michelle do a really wonderful kind of introduction of ACU, but I will just reiterate that ACU really is rooted in workforce, specifically through the National Health Service Corps. We were founded by members and alumni of the National Health Service Corps who said, we really need an organization that is dedicated to clinicians and healthcare workforce serving underserved populations. And so we have 29 years of history with ACU, and we're just I can't emphasize enough the commitment that we have to building and sustaining and uplifting the community health workforce. I would also flag that ACU actually has a fellowship to support this in the healthcare workforce space, not just dedicated to clinicians, but for healthcare workforce as a whole, because it is so complex and different to be caring for the communities that each of you serve and work with every day. But I'm really excited, and I want to just transition to the next 2 days and the work that you all do every single day to carry out the health center mission, but I think also in supporting and representing the healthcare and health center workforce. So when we think about the workforce of today, it's everyone. It is that interdisciplinary or transdisciplinary care team, but it's everyone, from those that are answering the phone to those who are handling security to treating patients, making appointments. it really is the entire healthcare workforce at the health center. And so I think the emphasis on today's workforce and sort of existing as that heartbeat of your organization, but I think quite frankly of your community, because the role that your health center is playing, not just to your patients, but I think to your community at large, cannot be overstated. And so it is every corner of the healthcare workforce that we are interested in engaging and supporting. And I know you're going to hear so much about that in the next 2 days. But I think the shift also to what does the future look like? When we talk about beyond, so 2025 and beyond, and thinking about the workforce of the future, I think the question that we will discuss and these guys will walk you through is how are health centers going to continue to recruit and retain team members? How do we build leadership pathways and training pathways for, again, sort of every corner of that workforce? How do we incorporate AI practice and technology into creating efficiencies, but also to better serve patients and all of the opportunities that go with it? I think that we are in the midst of a very interesting time. It's not without challenges at the moment, but I think there is a ton of opportunity at this moment as well. And so I think when we lean into what things look like today and supporting the healthcare workforce of today, there are sort of immediate needs and lots of, resources and programming and incredible team members. Again, many of you that have joined today, but I think those you're going to hear from and who have put this incredible agenda together. But I think it is also thinking about and being very intentional about what the future can look like and the opportunities for health centers to really be the centerpiece of how we continue to transform healthcare across the country and to the communities that we're serving. So again, I would just say a huge thank you to the teams for putting this together. Thank you to all of you for the work that you're doing day in and day out to carry out the health center mission, to bring in and build the health center workforce, and to lean into these really important conversations to continue to rise up and uplift each other. And I'm really excited. So I'm going to stop there and I will turn it back over. But thank you guys again. And we're always here to help and enjoy.
Great. And from here, we will pass it off to Margaret.
Perfect. Well, what a great group to be with today. So many good friends and colleagues. Really a pleasure to be here with all of you in the audience. And I think my first unscripted thanks goes to Megan for the invitation to our audience to come and go as you need to. We know the luxury of an entire blocked afternoon or a blocked day is rare and not possible in this work often. And so for people to be invited to come and go, I think is absolutely wonderful. And kudos to the planning committee for making that possible. Of course, a pleasure to be with our colleagues from ACU, from the Star Center, from NAC, and from HRSA, along with friends and colleagues across the country who do such incredible work. We know that we can have all the goals and aspirations in the world, but if we don't have a workforce that's ready and willing, expertly prepared, able, well to take on the challenges we face in healthcare, we just can't get there to fulfill our aspirations. So my name is Margaret Flinter. As was said, I'm the Senior Vice President and Clinical Director of the Community Health Center, Inc. and our Moses Weitzman Health System. I'm a family nurse practitioner of many decades duration and a proud alum of the National Health Service Corps, where I had the honor of being assigned as a scholar when I completed my graduate degrees to a small storefront clinic in Middletown known as the Community Health Center, Inc. And I never left. I heartily concur with all of the positive things that we say about the National Health Service Corps and what it's meant to so many of us. I have the honor of serving as the co-PI along with Amanda Shizzle, who many of you know, of our NTAP on clinical workforce development. And of course, Amanda and I give all credit to our senior program manager, Megan, who you're hearing from today, from Bianca Flowers, who's the program manager who did such an incredible job of organizing today along with their colleagues and every day. So I want to share with you that this is a anniversary year of sorts for us. I didn't really think about that until I was getting ready for today. It was just 10 years ago this fall that Carrie Bamrick and I, many of you know Carrie from the Consortium for Advanced Practice Providers. We got the call from David Bates at HRSA that our first application to be an NCA, as we called it then, a National Cooperative Agreement holder, was successful, and we were to be funded. We had proposed in our application that we focus on two major areas: advancing a model of team-based care, looking at the role of everybody individually on the team, and then the role of the team overall, but also supporting the development of what was then a new model called the postgraduate nurse practitioner residency programs in health centers. In the 10 years since, so many thousands, and Megan, I'm going to dare say maybe tens of thousands, so I haven't added them all up, but I think possibly tens of thousands of people across the country have participated in our learning collaboratives, our webinars, our trainings. And because of the foresight, I think, of HRSA and the way the NCAs were designed, the obligation to have publications to disseminate knowledge was there as well, and resulted in two books, not surprisingly, one on advancing a high-performing model of team-based care and one on developing nurse practitioner residency programs. These have been instrumental, as I think all of the NTAPs have, in helping people develop their programs and meet their goals, of which workforce is always a consideration. So I thank HRSA for their foresight in creating the NTAPs and the opportunity we have to reach out and engage with you, maybe for just a one-time webinar, maybe for a series, maybe for a learning collaborative, which I hope everybody would agree with me can be transformative in giving people in the field the tools and the knowledge to advance towards goals, towards aspirational goals, not usually remedial, but aspirational. I always tell people that HRSA makes it possible for the folks who hold these NTAP agreements. They make it possible for the health centers they reach out to, large and small, rural and urban, to have the best consultants in the world. And why do I say that? Because the best consultants are the people who really understand what it is you're trying to accomplish, who've been there on the ground and can help you get there to achieve those goals. So I think it's a really high value investment on the part of the federal government, and I am deeply appreciative that we all get to share in it. The summit has an exciting program from workforce well-being, which we're all focused on, to AI, to leadership training, and many other topics. And I think it is very appropriately future-facing. So let me stop. Thank you again for being here, for allowing me to speak with you for a few minutes. I appreciate all of you and all we can do together. So off we go. Back to you.
Fantastic. Thank you, Margaret. And from here, you'll hear from Dr. Padilla.
Hi, all. Thank you, and good afternoon, wherever you might be, and thank you. And it's a pleasure to be here with you today, and welcome to the 2025 Workforce Summit. Special thanks, as has already been mentioned, but I don't want to neglect giving a special thanks to the Advisory Council, the group, and the Planning Committee that put an enormous amount of work to make this summit come to fruition, and hopefully you'll be the beneficiaries of all that work. So, in 2024, NAC began an extensive, intentional, facilitated process to understand the needs of community health centers and solicit bold and innovative ideas from stakeholders, which form the basis of our strategic framework and our priority areas, intended to position health centers as the employers of choice, providers of choice, and partners of choice. And the achievement of that vision begins with a thriving health center workforce. It really is at the center of our ability to achieve those strategic aims. And so in collaboration with many of you, NAC developed that framework, put out those priorities, and is deeply committed to developing strategies for measuring, improving the satisfaction of staff, engagement of staff and community members, and the well-being of community health center workforce. Building a flowing pathway of motivated, educated, and incentivized staff, and using the grow your own philosophy as a central component of a health center driven model of workforce development. Recruiting from and partnering with local communities, and harnessing the power of ever-changing technology to advance efficiency, relieve the administrative burden that many of our health workforce clinicians and teams face every day, and empowering you, the health center workforce, to really course and plot out for us a direction that will continue to transform healthcare delivery in this country. And so We're honored to extend greetings to you and to our partners, the Association of Clinicians for the Underserved and the Moses Weitzman Health Systems, to host this Health Center Workforce Summit. And thank you for taking the opportunity to invest in yourself and to participate in these engaging sessions and discussions over the last 2 days. I'm especially pleased to be on a panel with my former colleagues, Jim McCray, Candace Chen, Dr. Chen, and Sarah Young. Very much looking forward to engaging with them. I think you're going to benefit from their insight, their decades of service, particularly in these trying times. And so I just want to share with you, again, my perspective here as the Chief Health Officer is that our ability to develop a competent, culturally competent workforce that's going to meet the ever needing needs of our community members, particularly at this time, is critical to our ability to continue to provide quality health care across this country. So I'm deeply humbled and honored to be a part of this Workforce Summit today. I think the agenda that you have for the next 2 days in terms of leadership development, AI, oral health care, emergency preparedness is very timely, and I hope that you'll benefit and will find this quite rewarding in the next 2 days. So with that, I'm going to hand it back to Gerard, and we'll begin the panel portion of today's opening session. Gerard?
Thank you very much, Dr. Padilla. Greatly appreciate your remarks. And since 2019, our colleagues and our federal partners at the Bureau of Primary Health Care, the Bureau of Health Workforce, and the Federal Office of Rural Health Policy have headlined this Health Center Workforce Summit. We've been so appreciative of certainly the commitment that they demonstrate every day to you as the Health Center Workforce and to us as partners. And so we're excited to have them back with us again, HRSA headliners, as we like to call them. And so if we can move to the next slide, we'll see who we have with us. Dr. Padilla already introduced or mentioned them, but just to reiterate, Jim McCray is the Associate Administrator for Primary Care at HRSA. I'm sure many of you know him very well, as well as Dr. Candace Chen, who's the Associate Administrator for Health Workforce at HRSA, and Sarah Young, who's the Director of the Policy Research Division at the Federal Office of Rural Health Policy. So I'm going to turn it back over to Dr. Padilla, who'll be moderating this discussion with our HRSA headliners. Dr. Padilla?
Thank you, Gerard, and welcome, panelists, Jim, Candace, Sarah. So are we on? Not sure if I'm going to be able to see them or not. You all there?
Yes, I believe I can see Jim McCray and Sarah Young.
Still waiting for Candace.
Yes.
Okay. All right. She's pulling a Luis. I did this a lot back in my tenure. I would show up like 30 seconds before a webinar kicked off and would infuriate our external affairs people. So while we're waiting for Candace, Jim, great to see you. It's a pleasure to see you again. Pleasure to have you here in the summit, and thank you so much for taking the time off your very busy schedule with everything you've got going on to be a part of this summit. So maybe while we're waiting for Candace, I hand it over to you. I don't know if you want to provide any opening remarks before I get into the question. Give you a few minutes if you'd like.
Oh, so you want me to stall now? That's great. Thank you.
Oh, I can go right into the questions, Jim. It's okay.
But seriously, thank you all for putting this summit on. I've been so pleased to be a part of this for the last several years. I think, as most of you know from working with me over those several years, I really do see our workforce as the most important part of everything that we do. It's really the foundation. Our patients, of course, in the communities we serve, but it's actually the staff that are that connection to make sure that people's health in communities actually does improve. And as we saw during COVID, that relationship and that trusted partnership is so absolutely essential to the work that we do. And the thing that's really excited me, especially in the last several years, is how the team has grown. When we think about workforce in our health centers, really the breadth and depth of the people that are involved. And I was so pleased to see in the agenda that you are taking a focus on AI and its potentials for really transforming what we do in workforce across the board. We are dabbling in AI ourselves here, and it definitely, we see the potential of it. We also know that it's important to understand it better before you fully implement it. And so would be very interested in hearing from all of you about what you see as the potential and also what are some of the challenges or things that we need to be thinking about to make sure that our populations are served again in the best way possible. But really looking forward to the session. Thanks again, of course, for the invite to be a part of this. We love having this session every year. So appreciate you all the different sponsors and partners who are part of this.
Thank you, Jim. Thank you. And Sarah, the same question is going to apply to you first or as well, but why don't I start with Jim? Obviously, Jim, there are a lot of priorities going forward with health centers, and you've already mentioned the importance of workforce. So if you could just share from your perspective, what are some of the key priorities going forward for the health center workforce as you see it?
Yeah, it's, I mean, as I mentioned at the very top, I mean, it's so critically important, the workforce, and thinking about workforce, not just the clinical staff, but really the staff throughout the organization, from the front desk to our governing board members, to all of our support staff, to all the different members of the team, and their critical importance. I think the good news, and we'll get to, I know, some of the challenges, but I think the good news is that we've actually seen the workforce continue to grow in the health center program. I know there have been challenges, but for the first time ever, we're over 300,000 staff that are serving over 31 million patients across the country. And when I was trying to think about what the priorities were, I actually decided to go back and look and see what the health centers actually said through their data to see what they thought was the most important in terms of their workforce, or maybe it's more a reflection of their ability to actually bring those folks into the team. But when you look at it, we've actually, over the last 5 years, we've seen an increase in the number of physicians by about 8%. We've seen about 13% increase in physician assistants. And then nurse practitioners has grown the fastest at about 15%. And that's sort of when we think about our traditional kind of primary care workforce in terms of on the medical side, those are our big pieces. We've also seen growth, though, in nurses and other professions. The other thing, though, that I was really interested in was to see who are the other members of the team that are growing. And I don't think it'll be a surprise to many of you, but we've seen the biggest growth in mental health and vision services. So we've actually seen a 23% growth in mental health. So that outpaced what we were able to do on our traditional medical side. And we've seen almost a 50% increase in the number of staff for vision. As we all know, that's not a required service in health centers, but I think we know our patients are absolutely needing that. So we've seen a big increase. We've also seen a really significant increase in pharmacy services. We know how much today pharmacy matters, but we've seen a 37% growth in pharmacists and pharmacy techs in our health centers. So we've seen real growth there. And then the last area, which, again, for those who have known me for a long time, that I think is absolutely essential and makes really the difference in the health center program, are what we call our enabling staff. So we've seen growth overall of about 22%, but there's certain areas where we've seen real growth. And I think, again, it reflects the priorities that health centers see for serving their patients. So that includes case managers that grew at almost 30%. Transportation staff grew at almost 30%. And then community health workers grew at 71%. I had to look at that again. So it's grown by 71%. And I think it, again, reflects what these individuals are able to provide to the team. They really are the glue that helps the whole team work more effectively together, whether that's doing outreach in the community, which we did a lot during COVID, whether it's helping scheduling appointments, whether it's doing the follow-up to make sure that people get back to their appointments, or basically connecting them with other peers in their community. So I think what the health centers are saying to us in the data is that we need to continue to recruit and retain our traditional medical staff, but we really need to think about the other members of the team, and we really need to increase our investments in those spaces. So the health centers, to me, are really saying that loud and clear. The other thing that I really have seen with workforce in terms of priorities, and appreciate, Luis, I will say this, and now with Candace, that partnership between our bureaus working on training for the next generation of providers. We've seen real efforts by health centers to do more community-based training. And as we all know, if you get people exposure to primary care, if you get them exposure to providing services in an underserved community, they're so much more likely to continue practicing there. So we've seen real growth. And in fact, in our most recent year, health centers were hosting trainings for more than 66,000 students and residents at a health center. And if there's one thing that I wish we could do more of, it's more in that space, because I really do see that as one of the key solutions to our workforce challenges that I know we'll talk about in a few minutes. But again, having people have that exposure at a health center is just so critically important. So again, we just really appreciate all the work that health centers do. Again, for me, workforce is critical. It's about 70% of any health center's budget. And so what we can do to help support our workforce and grow that workforce and retain that workforce is absolutely essential. So.
Thank you, Jim. And thank you so much for that. And I really appreciate you sharing the data, because I think it could be surprising to some here in attendance that despite the challenges, we're seeing increased number of workforce going in the health center. So I think that's a great positive note to sort of hang our hat on and say, okay, how do we build on that? Because we do have graduates of academic institutions going to health centers and seeking careers and opportunities to serve in those environments. And so we want to continue that. So I appreciate that. Candace, how are you?
Good, and I'm so sorry I dropped in a little late. I just ran across the HRSA building.
It's all right. No worry. I've been there. I know how that goes. Listen, I thought we'd ask you the same question here, Candace, in terms of the priorities going forward. Obviously, there are a lot of challenges. We'll get to that in a little bit. But from your perspective, now as the Associate Administrator of the Bureau of Health Workforce, what do you see the major priorities going forward for health center workforce? And I know that we talked yesterday on and thank you for being on our Health Professions Education Task Force, and we were talking about behavioral health, and you might want to maybe talk about that and maybe introduce one of your colleagues as well.
Yeah,
give you that
absolutely.
opportunity. So I hand it off to you, Candace.
Thank you so much. And again, I apologize for dropping in a little bit late. First, I think we have to recognize that we just have ongoing global challenges when it comes to health workforce. We continue to project shortages really across the majority of the health professions and health occupations. But in terms of our priorities, I think I'm going to echo Jim, and I'll probably echo Jim a lot throughout our time together, is I think that there's a real need to think about the teams and to really think about the full scope of teams, how those teams fit together, how to train the full scope of teams, and how to make sure that the training of those individuals is feasible, it is supported, and it is financially sustainable, particularly when you're talking about community health center settings. But in that kind of realm, I think one of the places that we see incredible need and opportunity is with the behavioral health workforce. And that's actually why I invited our new lead for our behavioral health workforce programs, Cindy Phillips, because I thought it was just so important. I wanted you all to be able to meet her, to see her face. She is fantastic. She's coming to us from the Maternal Child Health Bureau with years and years of experience with HRSA and the programs, but actually is the person who helped set up a lot of the behavioral health workforce development programs. And I thought, Cindy, if you would, and I'm going to actually defer the rest of my time to Cindy to talk a little bit about, I think where we see real opportunities in this space.
Absolutely. Thanks, Candace. And I have a soft spot for community health centers. I started my career as a medical social worker in a community health center. And as Jim may remember, 15 years ago, I started my federal career in BIPIC, working in the think it was the Southeast or West Division, something along those lines. So, and as Candace mentioned, I most recently came from the Maternal and Child Health Bureau, focusing on the maternal, infant, and early childhood home visiting program. So the behavioral health workforce, I mean, it's in the news all the time. All of the challenges that are happening related to behavioral health conditions. And there, the National Center for Health Workforce Analysis through the Bureau of Health Workforce has indicated that we will have significant shortages. We have shortages now, but significant shortages in 2037. And that's really scary. So 10 of the 12 professions that they track will have shortages. So the programs within BHW that address the behavioral health really focus on two sort of groups of providers: the professionals, so the social workers, the psychologists, the psychiatrists, the occupational therapists, and really expanding the training experiences for those students to practice in rural and underserved communities. And then the other, which Jim mentioned when he talked about community health workers, the paraprofessional workforce. So we have a number of programs that address increasing the paraprofessionals who support the families within community health centers, within other experiential training sites. And those include community health workers, addiction counselors, peer specialists. There's many different terms, and they really provide a good frontline support to behavioral health to the patients that are served. So, and we've been successful. We have increased the number of trainees within these professions, which is amazing. We've seen over 11,000 trainees in 2023, 24, and of those, about 7,000 graduates. And the statistics we like to see is that about 50% of those graduates will go on to practice in rural and underserved communities. So, we have a lot of work to be done, nowhere near meeting the unmet need that exists. But I'm really happy to be in this role and to be working with Candace on this. Thanks.
Thank you. Before we transition, anything else from Candace that you wanted to remark on the priority areas before
I'm
we tap
gonna,
Sarah?
Oh.
Go ahead.
I would just emphasize also, I think something that Jim was saying is that I think as we move forward with our programs, whether it's in the grants that we make or whether it's in, our ability to provide things like technical assistance, I think we're really going to be looking at what does it take for a health center to grow their own, train their own, put up training programs in the reality of the different requirements for the different specialties in different payment models in different states. And I think that is an area where we're really going to be thinking about how do we support health centers who want to do this and getting into the real logistics of being able to help them. And I suspect that as we do that, we'll be working very closely with Jim and probably with Federal Office of Rural Health Policy as well. So more to come.
Right. Thank
Thanks,
you, Candace. And thank you, Cindy. And it's a pleasure meeting with you. I think you've inherited, as you said, the BWIT program has been a historically very successful program. And when my time there, I always remarked it is a unique, what we call expansion program, and that you are adding new graduates into the field, and that's an important thing. And we'll circle back around as we talk about challenges, because you laid out two components of those programs. One is the professional side, which health centers aren't eligible to participate in, and the paraprofessional side. So, some inherent challenges in the way that those programs have been structured in the past, and health centers' ability to take advantage of the funding and programming that you all put out. But thank you, and it's a pleasure meeting with you, and congratulations on your new role at BHW. Sarah, Good to see you again. And obviously, we've talked a lot about in the past, certainly when I was there and talking with Tom, about the unique um, needs that rural America have in terms of workforce, and a lot of the things that we've already talked about in terms of shortages are amplified in rural and frontier areas. So thank you for being on the panel. And I think I would start by having the same question to you. What do you see from your perspective at a Federal Office of Rural Health Policy as the key priorities going forward for health center workforce, particularly geared towards rural and frontier areas?
Thank you, Louise, and thank you everyone for having rural health on this panel. Good afternoon. Um, to set a quick context for folks who are a little less familiar with our work, because I know some of you may not be, um, I'm of course part of the Federal Office of Rural Health Policy, and we're here in HRSA. And FORP was actually established in 1987 under Section 711 of the Social Security Act to really serve as a focal point for rural activities across the whole department and to help make those connections and understand impacts. And in fact, the word policy in our name is a little bit of a misnomer because we're not creating policy, but rather we're providing technical assistance to our colleagues in the department, in other parts of HRSA, and to you as stakeholders, so that as people are making policy decisions, they have the information and resources necessary to understand how those decisions might impact rural communities. And we also do a lot of work to help stakeholders like the community health center community understand current policies and find relevant resources about rural impacting health policies. The office additionally administers a lot of grant programs that focus on supporting and enhancing healthcare delivery in rural communities. And we know that community health centers are really a key part of that rural healthcare delivery system. And your organizations are both grant applicants and grant collaborators on many of the grants and other programs that FORP administers. So rather than get more into the data, I just want to acknowledge that in rural communities, we hear a lot from all kinds of rural organizations about healthcare challenges. And it's across the whole spectrum of the workforce, from the medical and clinical staff, but also information technology, cybersecurity, administrative, financial, billing roles, even environmental and janitorial services sometimes. In different rural communities around the country, healthcare delivery is struggling with all of those challenges. And as we get into this panel, I'll talk some more about some of the programs that we have really seen be very successful in rural communities from our office, and some of the approaches around supporting rural organizations and rural communities and trying to meet you where you are to develop, grow your own solutions.
Thank you, Sarah. So I think you touched on some of the challenges already. I don't know if you want to sort of expand. I think we've heard from Jim, there's an increased number of health workforce within health centers. That's an encouraging data point. We've heard from Candace in terms of the opportunity to expand, if you will, the health center presence and footprint on behavioral health training opportunities. I was wondering if we could transition to some of the challenges now, maybe starting with you. And you've delineated some of them, but can you share with us a little bit more in terms of what you see as some key challenges in the recruitment, retention, education, and training of a future rural health workforce for health centers?
Well, I think one of the biggest cross-cutting challenges we see in the health workforce development, and something we're trying to address with one of the programs I want to highlight, which is our Rural Residency Planning and Development Program, is really being intentional. Are we training people in the settings where we hope that they will work and practice? Because training somebody in a completely different setting and then saying, well, why aren't you practicing in a rural community? Why aren't you working in a rural health center or a rural hospital, when we never trained people to work in those settings, feels like it's asking the wrong question. And that's where we've been really excited, and my division is lucky enough to manage the Rural Residency Planning and Development Program, which provides grants to start new physician residency training programs in rural communities. We've been able to make new awards every year since 2019, actually. And as of this March, our grantees have established 54 new accredited residency programs that are training in rural community-based settings, with over 680 approved residency positions in those programs, which is just, many of us are, the rural programs are definitely operating on a smaller scale than the health center program overall, but those numbers are really impactful in the smaller rural communities where we're working. And what really makes this program significant is that those are physician residents being trained in rural communities, in rural community-based settings, to be comfortable and excited about going into rural practice. And the same thing is true for community health centers. In fact, over a dozen of our RRPD grantees are actually doing training, either the grantee themselves is also a community health center, or one of their collaborating training partners is a community health center, and they're pursuing the teaching health center GME model of residency training. So that program has really demonstrated that we can do successful training in these settings. And it's so exciting that we see these rural healthcare organizations conducting training and then reporting back about how much difference it makes to the culture of their organization, to their ability to recruit and retain those trainees over time. And it's really building a long-term foundation for success. Now, we know it is challenging to host training in high-stress outpatient healthcare settings. And a big part of the success of this has also been funding a dedicated technical assistance center that is actually based out of the University of North Carolina, which supports the grantees and then develops freely available resources for everyone. So if you are interested in learning more about rural residency strategies, I encourage folks to check out ruralgme.org. And that we have partnered very closely with the Bureau of Health Workforce on this program. And in fact, there's a sister project within BHW, which is the Teaching Health Center Planning and Development grants. And we've been able to facilitate both sets of grantees to share peer learning and support each other as they are all moving forward together on these challenging efforts to develop accredited training programs. And that's been really successful and really been a way to increase our knowledge in this area. And, just to emphasize, this is really an evidence-based approach. Recent studies found that rural exposure during family medicine residency training is associated with a 5 to 6-fold increase in choosing rural practice. And a second study found that rural training, in fact, is more strongly associated with rural practice even than having a rural childhood background. And I'm sure, Luis and Candace, that you can both quote similar statistics about training in health center settings being associated with subsequent practice. And that's, I think, one of our strongest opportunities to really build this long-term training network to meet the workforce needs in these settings.
Yeah. Thank you, Sarah, and thank you so much for highlighting again the partnership between FRHP and BHW on the rural training track and the PD program. I think that's been a very positive collaboration. I'm wondering if we could go a little bit out of order and go back to Jim. I don't want Jim to nod off, so I want him to keep engaged. So just wondering if I go back to Jim. And we've heard about the opportunities. I wonder if you could speak from your perspective, Jim, some of the challenges here that we're seeing. Certainly, you and I talked a lot about the infrastructure challenges, trying to tackle them, and so I'm gonna probe a little bit more on what you see are ongoing impediments to expand and increase community-based training within health centers.
Sure, and I appreciate that. I wasn't nodding off. I was excited. It's great stuff. This is fantastic. So,
I know.
I will share though that, and it's always one of the challenges that I have when I talk to health centers about some of the UDS data and then kind of what the reality is on the ground. So while the numbers are growing, and in some places really growing extraordinarily well, in other places we're hearing enormous challenges with being able to recruit staff, challenges with salaries, challenges with, especially in our rural communities, creating a setting where people would want to practice. So I'm not naive to that, and I just want everybody to know that we still recognize that that's a huge challenge for a lot of folks, and it's both on the recruitment side and ultimately retaining people to be able to stay in places that the work is great, but sometimes it's incredibly challenging. And I would say that's one of the other things that a lot of our workforce experience, which is primary care is being asked to do more and more and then some more on top of it. And how do we create an environment where the staff feels supported and not just like on a hamster wheel trying to process patients and getting through the day and dealing with sometimes incredibly complex situations and patient circumstances and things like that. So, I think that's part of what we're seeing with the workforce, bringing in some of more of those support staff. But it's really challenging from a clinical standpoint to deal with all of the social determinants of health, all the drivers, all those kinds of things, and do it where payment requires you to do it in 15 minutes. That's really challenging. So, I think several of the things that we need to work on together is, of course, more of our work around value-based pay. How can we get the payment structure to reflect the way we want to deliver care rather than the other way around, where the payment drives how care is delivered? And even in that circumstance, where we've seen in some states and even in some health centers where folks have been given the permission or freedom to think differently because the payment has changed, it's still a challenge because it's such a way of operating and functioning that it's really hard. So I think, with our TA partners that are part of this session and with our health centers that have kind of been out in front, gathering how they've been able to do it and sharing that more quickly amongst the community. How do you really make a transformation in how you deliver care when you do have the opportunity to operate differently in a more value-based environment? I think that's one of our challenges and one of our opportunities. So changing the payment and then actually changing the practice to reflect that, I think is going to be absolutely essential. Another big piece, again, which I've seen in the agenda you're going to talk about, I think there's some real opportunities with technology, but there's also some real challenges. Just helping to support our health centers be able to build their capacity to deal with technology changes. You got cybersecurity issues on top of it, but how do we actually, as a group, as a collective, make some inroads in how do you effectively use AI? I know there's lots of pockets where health centers are doing this. We also know there's lots of pockets where health centers have been able to do successful recruitment, retention, and training. And I think one of our challenges as a group is how do we surface those more quickly? How do we take some of those lessons learned? How do we take some of those nuggets from what people have done successfully to then share it that can actually be shared and utilized? Like, it's not just a one-off, but we're actually seeing a pattern of how, different health centers are doing this work, and how do we turn that into something that other health centers can use and gain some real benefit from. And I think that's one of our ongoing challenges. We have this incredible community of 1,400 health centers, 300,000 staff. There's an enormous amount of great work going on, but we struggle with how do we share that across and do it in meaningful, effective ways. And I think that's really something that we need to work on together. I think the other thing is just in terms of there's sort of two different aspects of training that I see. One is, and Sarah, you touched on it, it's so important to get people into health centers. And so how do we create both the physical space the time, the resources to be able to support training. How do we get that into the hands of health centers so they can actually do it and take advantage of it? And then the other part is, and I think this is kind of the corollary of it, how do you help training programs train folks that can actually start, maybe not on day one, but at least on day 30 or day 90 or day 180, where they feel comfortable and confident providing care? Because we see too many, and I've heard too many circumstances where people fresh out of a training program, college, university, they're not able to actually practice because they haven't really had to do it and they're struggling. And so then the health center ends up not just hiring somebody, but actually having to train them for X amount of time to get them up to speed to actually be able to practice in ways that are effective for the organization and for the patients themselves. So I think trying to figure that out. The last thing I'll just share, I know I'm going on, but we did do our workforce well-being survey a couple of years ago now. And, you know, I think the good things that came out of that is that you see that the health center staff are highly engaged. They do have good job satisfaction and they don't plan on leaving, which is like, really? Wow, that's great. They also feel that their work is meaningful. They have social support in their organization and they like who they work for. But they're challenged because they're overwhelmed, they're overworked, they're, you know, burning out. And so all those things that are positive kind of get, I won't say washed away, but they get colored by having too much work to do or it not being managed effectively in a way that they can actually survive. And then there are, of course, continued issues with compensation, which again, we've seen exacerbated by some of the challenges recently. And so trying to figure out all those different pieces, you know, compensation is one thing, but it's then how do we make the environment such that maybe they don't get paid quite as much, but the environment is so supportive to them and to their patients that they feel connected to it so much that they want to continue. So I think there's lots of challenges, but I think there's also lots of opportunities. And again, lots of best practices out there that I think we could all collectively do a better job of gathering and really learning from.
Thank you, Jim, and I, you know, kudos to the advisory panel and the planning team that incorporated well-being best practices into this session, because I think you're hitting on a very important part, and that is, you know, we have to focus on both bringing in new talent into health centers, but keeping and supporting the current talent that we have right now is such an important part. So, Candace, to you, you know, I think Jim and you've touched upon this already, and I just want to hone in again on the challenges that you all are facing in terms of supporting health centers in the area of community-based training. You know, you've made some strides, you know, certainly in our time there, our teams have made some strides, but, you know, just talking a little bit more about what you see of those particular challenges, whether it's eligibility of health centers into these programs or your views in terms of how you're thinking about supporting the infrastructure of health centers to do more education and training and to develop perhaps whether it's leadership or even joy in care opportunities for health centers.
I do want to address the challenges that we see, but I want to reiterate, I think something that I heard both Sarah and Jim talk about, which is again the value of training in health centers in rural communities, and that it's not just that you're more likely then to be able to retain and recruit those individuals into working in your communities or into other rural or underserved communities, community health center settings, but you're actually producing, I would say, a better product. Somebody who is going, and as Jim was kind of describing there at the end, right, that when we're whether you're a community health center or whether you're a rural community, if you're a rural community, you're recruiting somebody who was trained in a very urban setting, you're going to have to retrain that person, right? If you're a community health center setting and you are recruiting from somebody who's been trained in a very high resource setting, in a very different kind of practice model, you have to retrain those people. And so not to forget that when we train our own, and not to be Pollyanna about it's not easy to train, but but to remember that not only does it increase the likelihood, not only does it create opportunities for the communities that you serve, when we recruit and we bring our communities through the training pathway, when we train them, we are more likely to retain them, and we are more likely to retain them in the long term because they'll be prepared to care for our communities, and they'll have the resources and they'll have training. So I think it's never a bad thing to just emphasize that it's not just that people will come and work in the communities when we need them the most. They will be better at it, and when they are better at it, they will be more likely to be retained into our communities. On the, I'm going to request never to go after Jim next time, because I'm like, oh, Jim, you said everything that I wanted to say. But I will, I think we have to recognize right now that some of the challenges that we're facing is in a landscape that has always been a little bit, we'll say, uneven. Right now, we are in a particularly, not even uneven, but I think a moving landscape. So there's a lot going on in terms of Medicaid. For our workforce programs, there's a lot going on in terms of the policies being proposed across healthcare, across Medicaid, across our workforce programs. And so I wanted to recognize that at this point, it's probably very important to be vocal about the value of any of these programs and the potential impact to community health centers, to rural communities, to your ability to train and therefore be able to provide the care that is needed in your communities. But recognizing that, I think what I would re-emphasize is that it, in some ways, I think becomes even more important that we are really thinking, because as the environment is changing around all of you and driving the environment of care delivery, to be ever more intentional about retention. We can train, and if it's just a leaky bucket and all we do is lose them once we can bring them in. We have the National Health Service Corps, which is great at being able to support individuals to be placed and provide service for a couple of years. It has a great overall retention rate, but as the environment is changing around us, I think we always worry about retention. And so all those things that Jim was talking about thinking about workload, and workload is about staffing. And if we can train and if we can retain, that will create a positive loop. When we have a negative loop, it only becomes, I think, unfortunately, more and more negative, right? But I have to say, when we think about workload and we think about staffing and we think about staffing configurations and innovation, nobody's done it like the health centers, right? And historically, and last night, Margaret Flinter was on, and she might actually be on today, and the work that she's done in terms of putting up nurse practitioner residencies in community health centers, but not even just putting up the nurse practitioner residencies, but then doing the research to say, how much does it cost? What is our return on investment on these things, right? That work is incredible. And I think I just want to, whether it's about staffing configurations, team configurations, whether it's about looking at workflows and there's innovation that's happening across the health centers. And sometimes that innovation works, sometimes that innovation doesn't work. But that, when it works, when it doesn't work, that is equally important to be sharing. If I was doing something and somebody's already tried it, I don't want to, and it didn't work, I would rather know ahead of time that it didn't work, right? And so I think it's re-emphasizing how I think really both valuing health centers, because across the 1,400 plus different organizations and then 14,000 sites, right? There is so much innovation going on. How do you bring what works back in, help others do it? And then for us, I think that there is a need and an opportunity to say, and then how do you pay for it? And how do you, and what policies will support that? And really grappling with it down to the level of every different setting. And obviously state by state, there's a lot of differences in how we pay and we support that we always have to be thinking about. So a lot of work to be done, I think.
There always is, Candace. There always is, and thank you for that. And I appreciate you highlighting the broad benefits of community-based training to health centers, not just the recruitment and training piece. And I've always said, really, this is workforce development that is really intended to increase access, quality of care, right, and financial sustainability. Really, when you're training a workforce that is steeped in how you deliver care in its unique fashion within health centers and can help move forward. And I think Jim talked about value-based care. We're not doing enough to expose our learners to the future payment systems and models that they're going to be faced with. So we hear time and time again from health center leaders, while we're doing these things and venturing into alternative payment model contracts, our staff are still not steeped. And we've heard time and time again, we're leaving millions of dollars on the table because our staff are not really familiar with what we're doing, why we're doing it, and the rationale behind it. So certainly more to come on that. And I really appreciate you highlighting the broader benefits of community-based training. So, and I think that sort of brings you to the last question that I have. And Sarah, we can start with you, is how do you see workforce priorities, certainly in your rural space, aligning with the administration's Make America Healthy Again initiative? Because certainly I think each of you have touched on some things that might be aligned, but maybe if we could talk specifically how you see from your perspective, Sarah, and then we'll go to Jim to get his perspective on this. How do you see your efforts at FRHP and workforce efforts aligning with the MAHA initiative?
Well, the biggest part of Forbes funding is really programs that are focused on rural communities and community health needs. And the theme with a lot of the programs out of our office is meeting rural communities where they are. And that includes a variety of healthcare supporting activities, healthcare training activities. Our big main rural health programs include the Rural Healthcare Services Outreach Network and Quality Improvement Grant Programs. Those are usually collectively referred to as the Rural Outreach Programs, which improve rural community health by increasing healthcare access, focusing on quality improvement, improving coordination of care, and integrating services. And Congress actually created those programs back in 1991, recognizing the unique challenges faced by rural communities in accessing healthcare services. Another big piece of work out of our office is the Rural Communities Opioids Response Program, which are grants that are tailored to allow rural communities to meet their own needs, from developing early grassroots strategies to creating new access points and service lines. And of course, these grants focus on substance use disorder prevention, treatment, and recovery. And the RCORE program was created in 2018 and now has grantees providing services in more than 1,000 counties in 47 states and territories. And both of these programs, a lot of their work is on direct services, but a lot of those programs are very flexible. And so it provides opportunities for local organizations to identify workforce training as one of the gaps that is really impeding their delivery of the services that communities need. And we see many examples of innovative network approaches that develop non-traditional partnerships with community colleges, with employers, with schools to meet the local healthcare workforce needs. And again, it's that challenge, like Candace was talking about, of we've got great examples, we've got great cases. How do we scale those up? How do we make more people aware of those successful strategies? And then what were the real enabling factors that made that collaboration work so well? Because some of you have probably tried to reach out to community colleges and not gotten an answer. Other folks might have a great community college partner that helps you train your nursing or your therapy workforce. So what are the linking factors that make those things work? And another thing that my office supports to try, again, to help disseminate these best practices is the Rural Health Information Hub, which is a website at ruralhealthinfo.org. And I'll put that in chat, that has all kinds of rural healthcare information, including a whole section on rural models and innovations that highlights examples of organizations that did a rural healthcare improvement project. Some of those include training, some of those have other strategies. And we really welcome feedback on whether those are good tools to help spread the word, or what other formats would be helpful for you to look for examples and inspiration. Within the health center community, you have a whole national training network. So again, that's trying to spread these stories and case studies so we can replicate and scale them. And all of our work at the end of the day is about supporting healthy rural communities. That's really why we do this work.
Yeah, thank you, Sarah. So, Jim, I want to hand it off to you in terms of this question here in the workforce priorities, and perhaps meeting some of the challenges with the new administration, the opportunities that we have in aligning our work here and our workforce priorities with the MAHA agenda and initiative.
Yeah, it's a great question, Louise. I think, and you probably have seen it in different aspects of the work, but clearly the Making America Healthy Again initiative, one of the key focus points is around primary healthcare itself. So expanding the capacity of primary healthcare to be able to do more, expanding that opportunity for individuals to have that connection with a primary care provider is really important. So again, health centers are an enormous, I would say, successful example of building that trusted relationship within their community and with their patients. And that is something that, as we've engaged with the administration, the Make America Healthy Again is really trying to build more of those primary care relationships with patients. A couple of other things, and I've shared this in a few different settings, but clearly the whole focus on chronic disease prevention and treatment is critically important. This is something that the Secretary has spoken about quite a bit and is challenging us to do more in this space. So we have engaged already with several of our national technical assistance partners about how can we lean more into both the treatment side of chronic disease, which we're doing a good job on. More patients have their hypertension under control and diabetes under control than we've had in the last 5 years. We've seen some real improvements there, but they're challenging us to say, what can we do more? And then the other aspect is, what can we do on the front end to actually prevent these diseases? So what can we do with respect to healthy food, nutrition, food as medicine, really challenging us to think about how we deliver healthcare, to focus more on the prevention side and more of the aspects of care that really are the tradition and the roots of the health center program, and kind of challenging us to work with you all to figure out ways to do more of that in the health centers themselves. We also see a lot of emphasis around the connection between mental health and medical health and providing good services, so that integration of mental health and primary care, primary medical care, we see it as a foundation of what we do. But again, we're being pushed to think about how can we do more in that space? How can we partner better at the federal level to do that? That's part of this new administration for a Healthy America. But also, what can we do to support that on the ground level, to support that deeper and more meaningful integration of mental health and primary medical care? The other area which we've been emphasizing and we've made some progress in, but is the whole issue of cancer prevention and screening. So again, what more can we do in this space? We've done some investments recently that have proven to be effective, but how can we take that to greater scale to improve colorectal cancer screening rates, breast cancer screening rates, cervical cancer? It's like, what can we do more of? And so we're going to be challenging all of you as we're getting challenged to do more in this space. And again, I think it creates an opportunity for us in some cases to do things that either we haven't done before or want to do more of, to really, again, focus back on some of the key tenets of the program itself. So you will see that reflected in, for example, our service area competition guidance. We're asking folks to focus more on chronic disease prevention. We're asking folks to focus more on healthy weight, smoking cessation? What can we do more of around cancer screening, integration of mental health? So some of the things that many of you have already been doing, but really being asked to do more. And again, we're working with our TA partners to emphasize and highlight some of those best practices. So I think there's some real opportunities here, but it's going to challenge all of us to think differently, to think about, definitely moving from more of an illness model to more of a wellness model in terms of how we think about what we do and how we can better support that. So we look forward to working with you on these priorities.
Thank you, Jim. Appreciate that. Candace, I want to give you the last question here, a couple of minutes before we get into the Q&A for participants. Someone just blipped up. Megan, thank you for the 10-minute warning. So I just want to give you a couple minutes to add to what Jim was saying in terms of how you see your workforce priorities, BHW's workforce priorities aligning with MAHA and how we might be able to work together in that alignment.
And I think, again, I'm just going to largely agree with Jim. Obviously, primary care is so aligned with the focus on prevention and on addressing chronic diseases. I think that I completely agree with Jim also that there is a focus on nutrition. And as I've been starting to think about this, I often think about the opportunities that I've had to go visit community health centers, often because I was visiting their teaching health center. And so interestingly enough, integrated between their training and their delivery. I've seen community gardens. I've seen kitchens where and partnerships with food banks. But actually, that's a really important point. Is the partnership with communities that then gets you the activities that are going to be, I think, the most meaningful and most impactful when you talk about prevention and advancing nutrition. And then I think I would also agree, I'm going to tell you that I've read that MAHA Commission announcement way more times than probably anybody needs to, but I have read it and looked for those little key things in there. And one of the things that really, really does strike me is that there's also that focus on mental health, mental illness, and also a focus on the concern about overprescribing for some of these conditions. And I think that the only way to address those issues is to ensure that we have the full breadth of the mental health, behavioral health workforce to make sure that we can provide the counseling and the therapy and the psychoeducation, all of the things that actually go into caring for some of, I think, the most complicated issues that our patients face. And so I think those are some of the areas that we are particularly watching and looking for opportunities to partner and advance through our programs and partner with Jim and Sarah on.
Thank you, Candace, and certainly all of you, I think, have painted a picture in terms of how the opportunities and how we need to work together to pivot right now in this changing environment and with the new administration's overall agenda. And I think that certainly speaking for NAC, and as Jim has said, health centers have been in this space for quite some time, whether it's on management of chronic disease, whether it's whole person care, or even education and training. We've seen over the years so much development and build out of a health center's ability to do education and training. So we're anxious and excited to work with you all on this, because I think health centers are very well positioned to align with this and do more and take advantage of these opportunities that are in front of us and challenges that are in front of us. So I just want to thank all of you for your time and your presence here today and your leadership and your service. Certainly all of you are dedicated federal servants who are passionate about our communities, rural and underserved and frontier, and the quality care that they receive, and the workforce being really at the center of delivering that quality care. So thank you so much for everything you do. We're at the point now where we're going to open it up for some Q&A. So just bear with us as we invite our participants to put in the chat any questions that they might have.
And I see a few questions here in the Q&A. box here. There's one that will essentially combine three questions. That's really about expansion. The question is sort of what opportunities are there for HRSA to prioritize the expansion of the paraprofessional workforce, including community health workers, nurse practitioner residency programs, and AHEC programs. So who wants to take that one?
Yeah, I think he's pointing to
Might be
Candace.
trying to point at me. I think that it is a turbulent time, and first I want to very much recognize the fact that you may have seen the blueprint for the FY26 HHS budget that was released, and it pains me to say this, but the health workforce programs are proposed for $1 billion reduction in the FY26 budget. So first of all, I just have to recognize that the priorities of this administration are different than the prior administration, we'll say. And so I can't predict into the future. But actually, with all those programs that you're talking about, whether it's the AHECs, whether it's nurse practitioner residencies, and I think the first one was the community health workers or the peer support workers, right? I have to say that I think that, and actually led and initiated, and this is for Luis's, for me, led by Luis's leadership, I think that there has been a strong desire and push to make our programs more known and more available for community health centers and other community-based settings to be able to come in and be successful to get our awards and or require partnerships with community-based organizations. You see it across our programs. So as long as we have the ability to do that, we will continue to do that. And in fact, Jim was good enough in the last couple months, actually, when we were looking at competing some of our behavioral health workforce training grant programs, actually, well, I hope this is okay to share, Jim, shared with us which of all of you of the health centers were some of the workforce data, but also the data about who's training what, right? So that we could attempt to be very thoughtful and strategic, as we're saying. And I'm gonna, I think sometimes when we blast you with our funding opportunities, maybe many of you are at various points of we're not there yet, but we wanted to make sure that those who might be there would be able to see the opportunity. And I think that our goal is to just be intentional, and continue to build off of those. And again, I was so excited to be able to just even see which of the health centers were reporting training and then who had different kinds of health professionals, because if you don't have a psychologist, you're probably not ready to start a graduate psychology education program. But if we know who has psychologists, if we know who's training, we can start to be really strategic about, hey, how do we make sure that you get the information early? How do we make sure that you're ready to come in for our funding? And we still have to compete them, but I think you'll both see that kind of effort as well as efforts within the funding opportunity announcements, as long as we can do them, to make sure that they are prioritizing the types of organizations and training settings that we know will actually produce the people who will serve the communities of greatest need. Right? So I think that is, we see you, we value you, and we want to continue to start what Luis started, and what we're hoping is to just see more and more health centers coming in for those awards.
And I think I want to build on that, Candace, to say, we can't predict the future, so we don't know yet what future funding opportunities will be. But as you are planning ahead and strategizing, it really makes a lot of sense to look at past funding opportunities and see what kinds of things might be a good fit for your organization and your community. Like I mentioned, we've actually had sufficient funding to compete RRPD every year since 2019, and we've made new awards every year. If you've been paying attention, you can get a pretty good idea of what might be in the next funding opportunity by reading last year's application, even if it's already closed. And that gives you ways to think about developing those partnerships and those collaborations. Um, Certainly with the rural communities we work with, but frankly, everyone in the health center space, you can't do all this work alone. And so how do you identify the best partners in your area who can really help fill in some of the gaps in capacity, and who you can develop mutually beneficial collaborations with? Um, so certainly use our resources, get familiar with the things that are the right fit for you. You don't have to read every funding opportunity, there's a lot of them, but figure out which ones are the right fit for your community and your organization.
Thank you, sir. And I think, Gerard, I don't know if you're taking over the helm. I think we're at time right now. I don't know if you're going to give us a leeway for one more question, or you're going to stick to schedule.
I think we're gosh, I'd love to ask one more, but I'm going to stick to the schedule. But I tell you, what a great way to start off this workforce summit. I just certainly appreciate all of our federal partners and for all of the support and for your insights and for your candidness with us. We really appreciate that here for the summit. So please. Certainly, I know all who are in attendance join me in expressing appreciation for Dr. Candace Chin, for Jim McCrae, and for Sarah Young, our partners at Bureau of Health Workforce, Bureau of Primary Health Care, and the Federal Office of Rural Health Policy. Thank you, Dr. Padilla, for moderating this session for us. We'd like to certainly invite those who are joining to take a break. And for, I think we have 15 minutes, so 1:45 Eastern Time and 10:45 Pacific Time. Please rejoin us. Thanks so much, everyone.
Thank you all. Thank you. Great to see you all. Thank you.
All right, welcome everyone. I believe it's time. I think we're at 1:45. That's the time we're starting again, correct?
You are correct, Tanya, so go ahead.
Awesome. Well, welcome everyone. I will give just another like minute or so for folks to kind of make their way back from the break before we get started. But we will be starting this session on workforce well-being and talking about some promising practices. And I'm really glad you all are here today. I saw in the word cloud that we had during the break that some folks have put in, their reasons for attending today. And some of that was like learning new things, skill building, strategic planning, which is great. Hopefully some of this time slot session can help give you all some things to think about as you're doing some of that strategic planning and kind of skill building and giving you some things to talk about within your workplaces. All right, so we'll go ahead and get started. Welcome everyone again. Thanks so much for being here. Our session for this time slot is going to be on workforce well-being and supporting promising practices. Let me see if my thing will not let me move. Okay. My name is Tanya Phillip. I am a training specialist with the Association of Clinicians for the Underserved, also known as ACU, which I'll talk about in a little bit here. I help out with a lot of different things, developing and delivering trainings on a lot of topics around recruitment and retention, health professions education training, workforce well-being, kind of a little bit of a lot. But just for you all to kind of get to know me and where I'm coming to today's presentation from is my background is in mental health. I've done a lot of work in the mental health space with folks, families and individuals who have experienced violent crime, family separation, different things like that. Naturally, throughout the course of my career, I've taken an interest in that those skills have transferred a lot into working towards and advocating for well workplaces, right? And work environments that help keep our staff healthy and well, and in an environment where we all feel like we can thrive and bring our best selves to work. So that's a little bit of kind of the lens that I'll be coming at today's presentation from. Apologize, there's a little bit of a lag in moving my slides. Okay, here we go. So a little bit about ACU, which is short for Association of Clinicians for the Underserved. We started, I think, roughly 25 years ago by alumni of the National Health Service Corps. And while we've changed a bit over the years, as any organization has, our focus remains the same, right? Our goal is really to improve the health of America's underserved populations and support the clinicians and the staff that are serving in those areas. To that end, we focus a lot on recruitment and retention, and we really believe that the recruitment and retention of a transdisciplinary team is part of the road to achieving that goal, right, of improving healthcare in those communities. ACU has a whole host of different programs, including vision services programs, training resources for clinicians and patients around suicide safer care, as well as a ton of other trainings and resources. Hopefully you all are already familiar with us, but if you're not, you can find out all about the different resources and trainings and all the different programs we have on our website, which is www.clinicians.org. Feel free to check that out later, maybe after the session or during a break. But today, what brings me here is one of our BIPIC funded programs called the STAR Center. Some of you also may be very familiar with the STAR Center. STAR stands for Solutions, Training, and Assistance for Recruitment and Retention. And the STAR Center is a program of ACU that's funded by a national cooperative agreement by the Bureau of Primary Health Care. We're one of 22 national training and technical assistance partners, or NTAPs, that focus on really niche areas relating to health center programs. So our specific area that we focus on is recruitment and retention. Since the STAR Center started, we've been producing free resources, training, and technical assistance, a bunch of different amazing resources. I'm here today on behalf of the STAR Center, but really, if you all have had a chance to meet some of the other STAR Center folks on the line, Michelle, Sydney, Mariah, they are the real superstars. All of those resources are free, a bunch of the recordings of trainings, things like that. So please, if you have not already, check out the website that is specific to the STAR Center that's on the screen right now, chcworkforce.org, or you can also reach out if you want to contact someone about working closely in the future. All right, so some of our learning objectives for today, kind of what are we here for? What are we here to talk about? My hope is that you all walk away with a better understanding of the pillars of employee well-being, a little bit more of an understanding of the ways that health centers and leadership in health centers can help support employee well-being, and the ways we might be able to kind of infuse that into some of our policies, practices, our structures, the ways that we kind of show up to work every day. And lastly, to understand how workforce well-being actually contributes to furthering the mission of health centers, right? How it can help us achieve these goals of improved patient outcomes in the areas that we serve. So we believe here that workforce is the fuel for your health center's organizational efforts, right? Quite simply, if we didn't have a workforce in our health centers wouldn't be able to see the patients that we're funded to serve and to do what we're designed to do, right? Provide those critical services. So by having a full fuel tank, so to speak, of workforce, a health center identifies workforce as an essential organizational issue. It invests in the appropriate operational and staffing resources, and really takes care of its investment, right? That workforce that it's investing in. So when I talk about this as like a full fuel tank, right? I want to invite you all to try to think of full as more than just numbers, right? More than just being fully staffed by having a person in every position that we have, but rather to challenge ourselves, right? To think about all the other things that go into making sure your workforce, your employees, everyone that contributes to our health centers or our workplaces are truly well and healthy in their full lives, right? Right. So we have a poll for you all that should pop up on your screen right there. Does your organization currently have a staff wellness or well-being program or plan? Go ahead and take a minute to just submit your answers there. All right, we'll give just a few more seconds for folks to get their responses in. All right, I see a question in the chat of if the slides will be sent out to folks afterwards. I believe so. That might be a better question for, Michelle, I see you.
Yeah, yes, all of this for all of the registrants, this is going to be shared with everyone. So over the 2 days, all of the slides and everything that we're sharing, absolutely everyone will receive it. So thank you, Tanya, for letting me jump in to, to answer that.
Yeah, thank you so much, Michelle. All right, let's go ahead. It seems most people have answered. And I'm seeing here, I can share the results. It looks like about 46% of you all have said yes, you do. That's great. 27% said no, 8% unsure, and 19% sort of. Okay, that's great. That's awesome that we have kind of a variety of folks in the space in terms of your experience with staff wellness programs or well-being plans. That's totally perfectly and fine. And I think it's actually great because we will have some opportunity to chat and kind of share as well as breakout rooms after this. which I think, so for those of you that have experienced or maybe like a sort of like we do some things, I don't know if it's a formal plan. I think that's a great place for folks to share kind of what you've seen work well in your organizations, you know, what you've tried maybe. As you'll see throughout this, a lot of this is kind of how do we build something like that. So thank you all for participating in that. All right, so what actually is workforce well-being? Well, it's creating, quite simply, it's creating a norm or work environment that encourages the well-being of your staff, right? A culture of wellness will make health really integrated as a part of your company's mission and empower employees to get healthier, happier, and more productive by creating and nurturing healthy habits. It might mean implementing ways for your employees to be healthier in the workplace and helping them create and sustain healthier habits, both in their personal and professional lives, right? I know often we tend to think about the personal and the professional as being kind of two separate things that we should keep completely separate, right? But, you know, the truth is that they do impact each other, right? How we're doing in our personal lives and how we show up in our workplaces impacts each other, right? Impacts how we're able to show up in the opposite space. And that's really, really important, right? If we can take care of ourselves, if our staff are encouraged and supported to take care of themselves in all of those areas, they can show up to work in a better way. And this is really important, right? Because your employees are directly affected by the norms in the workplace, right? For employees to be motivated to become healthier and prioritize their well-being, you need to develop a workplace that supports that, right? And even rewards maybe healthy behavior change and healthy habits. So one more poll that we have for you all. What factors do you think go into well-being? So we have here physical health, emotional health, financial wellness, effective communication, real and perceived safety, or other. And you can choose as many as you think apply. All right, we'll give just a couple more seconds for folks to get their responses in. Oh, okay, a bunch of last minute responses coming in right now. Awesome. All right. So we have folks that have checked every single one of these, which is great. Trick question, yes, the answer is all of the above, right? Let's see here. If I can get my slide to move. Okay, yes, for those of you that chose multiple or chose all of them, you're correct. Having total wellness means you'll need to have programming or considerations to address a whole multitude of facets in your employees' lives, right? I included other on there because I think, you know, we're going to talk about these 4 pillars of well-being to consider, but there's so much more that goes into that, right? There's never like a quick, simple, easy checkbox list where we can do all the things that make us well, right? There's so many, we're such multifaceted people and lives that so many things go into that. So the 4 main pillars that you might want to consider in well-being are how your staff's physical, emotional, and financial wellness to begin with is built into your organizational norms or environment. You might think about addressing physical health needs, such as nutrition, exercise, healthcare, insurance coverage options, different perks that come along with that, or other benefits. When thinking about, you know, someone's emotional well-being, you may consider encouraging the use of EAP programs, mental health benefits, the availability or access of different things, right? Like meditation tools or apps, social groups or programming that might support kind of community building and camaraderie amongst your staff. You may consider ways to make people feel included or appreciated in the workplace, and ways to lessen the stress that's inherent in their jobs, right? We all know working in healthcare is not an easy job, right? There's a lot of stress that cannot be avoided, but thinking about what are the ways that we can maybe lessen that? What are the ways in the day-to-day of people coming to work every day that we can take little pieces of that stress and that burden off of their plate? And that might look different, right, for every setting and every location. When we talk about financial well-being, right, while we all wish we could pay our people more, and paying a thriving wage is definitely important, some things you may also want to consider if you're not able to maybe adjust people's salaries and things like that, maybe considering what are ways outside of pay that you can enhance and support your staff's financial options, ending their education and financial literacy, right? And lastly, but certainly not least, the ways we communicate are so important. And I say certainly not least because I could probably do a whole day training on just communication. It is one of my favorite things to talk about. But it's really important, right, that we're modeling healthy, respectful, and open kind of transparent communication, especially as leaders or people in leadership positions within our workplaces, right? So for one, that models for other folks the respect that we have for them, the ways that we want to be transparent and deliver information, but also encouraging this style of kind of open, respectful communication between teams and team members as well can help add to a healthy workplace that encourages just a positive and more better experience for folks at work, right? If anyone has ever experienced being in a setting or a place or a group where people are not necessarily communicating clearly, or they're communicating in a less than respectful way, it doesn't feel great, right? Imagine coming every day to work at a place where maybe it's unintentional, but the communication kind of has some issues, right? So that might be something for us to think about. Oh, I think.
And Tanya, you can ignore that poll. Sorry, it was an old evaluation that I forgot to launch. So I'm just going to have it up for folks. Thank you so much.
No worries. Yeah, please go ahead and fill that out while I'm talking. All right, so continuing our discussion, right, of what workforce well-being is. We talked about those 4 pillars, but there's no magic solution, right, to keep every employee, every team member, every clinician healthy and happy. What is really important is offering a variety of services or options and making it easy for your staff to pick and choose and utilize the services that are going to benefit them the most, right? So think about it kind of like a menu, right, at a restaurant, making sure it makes sense. There's a whole bunch of things. Not everyone is going to want a burger, right? Not everyone likes mac and cheese. Dairy's not going to work for me, right? I might not choose that, but making it easy where people can look and see what's available to them and easy to choose and opt into the things that are going to make the most sense for them, right? That they're going to enjoy, that are going to benefit their life and their well-being the most. Now, this doesn't necessarily mean that every employee will take advantage of or participate in everything that you offer as part of a wellness plan or program. And that's okay, right? Each of our employees is different, as I mentioned before, and has different needs. We want to make sure not to turn an initiative like this, like a wellness plan or a program, the things that we're offering, we want to make sure that doesn't turn into something that feels like an added job responsibility, right? But instead it should feel like something that can benefit our staff. That's easy for them to use, easy to participate in. We also want to build norms around utilizing these services regularly, right? It may start slow, especially if you don't have any kind of programming or options like this in place already. It may start slow, so don't get discouraged if only a handful of people start utilizing it in the first maybe month that you offer it, right? It might take some time. Making sure that people know what is available to them and how it can benefit them is one of the first steps, right, in normalizing the use of well-being benefits. And don't be afraid to talk about it, right, or recommend things that maybe you personally have used and found helpful if you're comfortable with it. So an example of this is, I used to work at a place where our insurance plan covered acupuncture and a massage benefit. If your primary care provider would write a letter saying, we work in this place that is like very high stress and creates a lot of compassion fatigue, and this person would benefit from massages. And if you can find a massage therapist that takes insurance, boom, insurance covers it, and you just have to pay your copay. If you're not combing through all of the language and all the handouts that come when you start a new job and you enroll in this new plan, most people don't know that that's one of the benefits available to them, right? But our HR professional that onboarded me told me about this. And to make it even easier, collected from all of our staff if they have used this and they have a provider that they would recommend, if they found a massage therapist that does take insurance, for example, right, that is in network, and they wanted to share that information, she had this kind of running list that people could go if they're like, I'm having a hard time finding where I can actually use this benefit. She was like, here's a list of people that others have used before and had a good experience with, right? Made it easy and encouraged a conversation around it as well. The same with so many, health insurance plans offer a benefit for a gym membership or things like that, where it might be free or reduced price, things like that. That was a benefit that she looked through and was like, no one's using this. Why? It's so those things are expensive, right? Like a Pilates class membership is very expensive. A gym membership at a upscale gym is pricey. So she started talking about it, right? And was like, oh, look, at this yoga studio I go to, a drop-in class costs this much. A monthly membership costs this much. When I enrolled in this program, I only had to pay this much. And then a bunch of our staff were like, oh, whoa, really? Let me find out more about that, right? How do I do that? So normalizing that, having that conversation started. All right. So investing in well-being is a great way to ensure that you have both happy and healthy employees and great organizational results, right? Having programs and plans in place to promote wellness will make your team healthier and happier, as well as more productive, right? When folks feel good, they can do good, right? They can show up better to work. When you truly value your employees' well-being, it'll show in the way your staff show up, how they interact with patients, and ultimately, we'll see that in patient outcomes. You'll likely have less turnover and staffing changes because your team will want to continue working for you, right? They'll come to work feeling better, showing up better, and interacting better with their colleagues as well. Healthy employees will also be more competitive and more focused, which can help you better achieve your organization's objectives and result in improved patient outcomes, as I mentioned, right? Which is, at the end of the day, the goal that we're all here for. Just check, I see a few things in the chat. Okay. All right, so if you are brand new to this or looking to get started on building a well-being plan for your organization, there are a few steps you should take into consideration, right? Just these are kind of high-level things you might want to think about. So first, as with any initiative that you're wanting to get off the ground, you'll want to secure leadership commitment and support for a successful plan and implementation, right? If we can all be on the same page, be bought into the value of this, it will always run so much smoother. Next, you may have some ideas generating in your head already, right? Some things that you're thinking about would be great, but it's always a good idea to gather some feedback from your staff, right? You want to better understand their experiences and their needs so that you can make sure you're investing in programming that is actually going to be the most useful for your unique workforce and their needs, right? So we may think like, oh yeah, it'd be great if we can have ice cream parties every Friday. That'll really increase morale, right? Which maybe it will, but also maybe your staff's like, I don't really care about ice cream parties. I don't even have time to go down and grab ice cream on a Friday in the middle of my shift, right? So you put all this work and effort into getting this together, and then no one utilizes it, right? That doesn't feel great, but also we don't want to waste our time, resources, and our money on things like that as well, right? So it's always a good idea to kind of gather some feedback, some interest. What will actually benefit people? What are they interested in? Next, after gathering that feedback, is what I consider the most fun part. It's where you get to figure out what to do with it all, right? With all the feedback, all the answers, responses that people have given you. This is when you look at what are all those needs that were expressed, and you get to be creative, right? And try to come up with a plan of how you're going to meet those needs. How can we implement it? How can we actually make this work? This is my favorite part because I think it allows us to kind of get in a different headspace, think a little bit differently, right? What have we not been doing and what is possible? And lastly, you'll always want to review your plan after it's been implemented, which could include some measurement and feedback collection, again, from staff, and then lead you to make updates or changes as needed, right? Again, we'll talk a little bit more about this in the next few slides, but no one expects you to do it perfectly the first time, right? But we all have to start somewhere. Okay. So when we talk about that first step on the last slide, right, securing leadership commitment and support, it can be helpful to make your case for why this is something they should care about, why it's something we should invest in. We've already talked a little bit about how when staff are well, they contribute to our health center's mission better, right? Patients get better care and staff get to work in a better environment. Increasing well-being can lead to increases in longevity, retention, productivity, and staff engagement. It can reduce absenteeism, burnout, and turnover, which we will discuss a little bit next. So cost is a serious consideration in any workforce plan, initiative, well-being plans, any initiative you're wanting to get started, right? And it is expensive. If your leadership speak the language of numbers, right? You can use the Star Center's financial assessment tool for provider burnout, turnover, to figure out, kind of calculate the actual cost of turnover for different positions within your health center. So thinking about, right, how much money is being lost to these workforce issues can help back up your case with a dollar amount if that is, if that is the way that your leadership wants to look at this. And sometimes that's very real, right? That's a valid point to make. Sometimes seeing these numbers can encourage us to think about how we can better invest our money into additional ways to retain the staff that we already have, right? How can we keep them happy and well and keep them here? The investment in prevention is often more fiscally responsible than paying for the results of poor health, turnover, and turnout, right? And that's a great resource. You all will get these slides. If you haven't already seen that tool, it is a really great resource among many other that the Star Center has. Okay. All right, so when we talk about that next step in the process of gathering staff feedback on their experiences, their needs, one way to do this is to incorporate questions related to this in your staff satisfaction survey, if that's something that your organization already collects. You'll also want to consider other more frequent ways to solicit and gather feedback, such as regular check-ins, communicating with folks, having more regular conversations about this. You'll want to carefully consider what information you'd like to collect and be intentional about how you can get the most responses from a wide swath of your staff, right? So for example, if you know and feel that your staff is already kind of having survey fatigue, survey burnout, they're like, I don't want to answer 20,000 surveys every month. Maybe find ways to incorporate it into things you're already doing, right? Instead of introducing a whole new thing. Next, you'll want to sit down, review, and analyze the feedback that you've received, right? You may want to look at what patterns or trends kind of emerge and come out of that, what common responses are coming up. That'll give you clues as to what your priorities might be when you move into developing a plan, right, of what you might want to offer and put together. Next, I can't stress the importance of communication enough, right? It may take some time between asking these questions, deploying a survey, collecting the feedback, and actually launching a program into action, right? Sometimes that can take a long time. because there's so many moving pieces. But it's really important that you communicate with your staff what you heard from the feedback they've given, and maybe what your plans are, right? How you're working on addressing those needs that they've shared. When it takes a long time and staff don't hear anything, sometimes they can feel unheard, undervalued, like they're just answering all these questions and surveys, giving their thoughts and time for nothing, right? For no reason. That doesn't really feel great. It doesn't do a lot of great things for morale. So don't let silence derail your efforts, right? If you talk about it, you share it even as much as, hey, these are the things we heard you say. We're working on a couple different ideas to address it, right? You may not have a fully fleshed out, finalized, approved plan yet, but just communicating back, we heard you. We see and hear what you're saying, what your needs are, and we're working on it, right? That can go a long way. And then lastly, you'll put together your plan and put it into play. When designing your survey, if you're gonna ask, if that's the way you're gonna gather staff feedback, or designing your response, right, and what your plan's gonna be, you'll wanna keep in mind those 4 pillars of well-being that we talked about. Think about how you're asking staff about their physical well-being needs, whether that be movement, healthcare, illness, nutrition, family planning, whatever it encompasses, right? Think about how you're asking about their emotional wellness and their emotional needs, whether it's something like mental health resources, wellness practices that they already use, or are interested in trying, their professional quality of life, right? The same with their financial well-being and resources that they might be interested in. Maybe even asking how they feel about the communication within your organization, right? And then when we're responding to that feedback or developing our strategy, developing our plan, you'll also want to keep these 4 pillars in mind, right? Make sure you're trying to hit something to address each one of these pillars in your plan, even if it's indirect or it seems small, right? There are a ton of different ways that organizations prioritize these different pillars in their well-being plans. And it's not wrong, right? Even if it's something small and tiny, or it's shifting maybe the way we send emails, or something about the way we communicate in a chain of command, right? Those little things sometimes go a long way. Remember, the goal is to offer, as I mentioned at the beginning, the goal is to offer as many options so that employees can choose what benefits them the most, right? Don't be afraid to get creative. Here are just a few ideas to help you get started. They're kind of very general and broad, and you can do them a whole lot of different ways, right? So encouraging movement. What are different ways that you can encourage movement throughout the day? How do we offer healthy choices, right? Whether that be in the vending machines or when we bring in food for an all-staff celebration or gathering, offering healthy choices, encouraging healthy habits, providing opportunities for social engagement, right? Maybe that means how do we foster, outings or space for staff to connect with each other, whether it be around work-related topics or not, right? We spend so much time with our colleagues and our coworkers. How do we encourage kind of camaraderie in that community building? How do we develop a community? Because remember, right, social wellness, whether you group it within emotional wellness or physical wellness, it is just as much an important part of the health spectrum as any of those things we generally think of as health, quote unquote. We can provide resources, right? Whether it be for any of those pillars, there are different resources. It might not always have to be something we are programming that we are creating and providing. It can be something as simple as providing resources to our staff on how they can incorporate different things or access different things. Be flexible, right? If your company can allow it, go for it. Encourage a healthy work-life balance. Lessen stress, right? Like I mentioned before, there is so much stress already inherent in our day-to-day jobs, especially in the healthcare space. Think about what are the ways we can lessen that stress. Provide opportunities for self-expression and creativity, right? Whatever that might look like for you or for your organization, right? There is so much value to creativity, different forms of self-expression in ways that can really benefit people's well-being. And then lastly, we want to offer maybe financial benefits, resources, education, things like that. These are just like very broad swaths of suggestions, right? They are by no means an exhaustive list. Then again, when we talk about communication, try to focus on a culture of two-way communication, right? Or bidirectional communication. This can continually improve the practice experience. It can reduce burnout and support multidisciplinary teams even in a consistent way. If we can foster a norm of open communication and dialogue, that'll help build trust, and it goes a long way in helping staff even to feel supported. The language we use is powerful, right? And it serves as both a way to communicate with others and a way to help shape our work norms and environment. So, really thinking about and being intentional about what you say and how you say it, what you do and how you do it, the actions you take, it really does matter, right? Especially if you are leadership in an organization, the way you deliver information and messages, the actions you choose to take might not always be the things we want to do, the messages we want to deliver, but the way you do it really does matter, right? And goes a long way in setting the tone in the norms of communication in your organization. Taking a strengths-based approach and concentrating on the inherent strengths of individuals, right, our individual staff, teams, their families, or their groups, really does a lot to aid also in empowerment and self-efficacy for our staff. So thinking about that as well, right? How do we take a strengths-based perspective? And then lastly, building appreciation into your norms and your communication styles even is a small thing that can have a really huge impact, right? This can look a lot of different ways. It can look like finding ways to appreciate or celebrate staff achievements, whether that be formally or even informal ways that our teams show up for each other, right? Or our colleagues show up for each other. Right, so you'll want to, like I mentioned, after kind of implementing, you come up with your plan, you start rolling it out, you'll want to continue measuring, reviewing, and updating that well-being plan. Again, I will repeat it a million times, no one gets it perfect the first time, and no one's expecting you to have all of the answers, but we have to start somewhere, right? And asking your staff for their honest feedback does a lot to show them that you are listening and that you care about what is actually going to be useful for them, what's actually going to benefit them. That also kind of, it snowballs, right? It adds to building trust and encouraging folks to also utilize those services that you're offering or those different options. Builds buy-ins for this programming that you're building. So make sure to also assess both your successes and your challenges, right? So figuring out what has worked and what hasn't worked, what was great and what was maybe a challenge. And remember that a plan is never really a static document, right? Think of your well-being plan as something that will continue to grow and evolve over time, just like our organizations do and our staff does. This is something, to that end, you might want to review and maybe make changes, edits to either on an annual basis or, whatever time frame kind of makes sense for your organization and your workplace. And then lastly, I'll close out with just a few kind of things to remember, things I want you to walk away with, is there are so many ways to load a dishwasher, right? I'm sure so many of us have experienced getting in an argument, getting in little tips around how someone loaded the dishwasher wrong. There's so many different ways to do it, as long as the dishes come out clean, right? And I say that to say, as long as at the end of the day, our staff feel supported, can be well, can be healthy, and show up as their best selves. There's no one right or wrong type of programming or program or benefit that you need to offer. So I leave you with these few things, right? Be creative. In healthcare, there are so many things that have to be done the ways they have to be done. This is a place where we get to be a little bit creative, right? Think about blue skies. If we could create the perfect environment, right, in our workplaces, what would that be? How can we get closest to that in reality? ask for suggestions, right? Again, no one expects you to know everything off the bat. Talk to your staff, ask them for suggestions, ask them what they're wanting, what they could benefit from. Collaborate with other colleagues. We're going to have some time after this for breakout rooms where I would love for you all to talk with each other about what has worked in your organization, what you've seen other people doing that you'd like to incorporate, things like that, right? There's such a wealth of knowledge that exists within our larger workforce, and it really is a shame for us to operate in silos. So connect, see what other folks are doing, see if that makes sense for your organization. Remember that, your staff and their needs are unique. So check in with them, right? What may work or what needs may be present, for example, in your state, in your city, in your town, might be different from someone somewhere else. In rural areas, for example, our staff's needs might be very different than in a major metropolitan area. And that's okay, right? But we should be programming to the things that our staff really needs. A reminder again that simple things can have an immense impact sometimes, right? So don't shortchange yourself. Don't think that something is too small to be a valid part of a well-being plan or program. It's not, right? Those little things sometimes have such a big impact and can snowball into a much larger shift in your culture. And lastly, don't be afraid to think outside of the box, right? Just because it hasn't been done before or we've done it differently in the past, I challenge you to really to challenge yourselves, right? And your teams to think outside of the box. Think about what is possible and what is the why there, right? How are we valuing the well-being of our teams? All right, I will end there. Do folks have any questions?
Hi, Tanya. Thank you for that wonderful presentation. We did have a couple questions in the Q&A that I thought maybe I could jump in and help answer some of those.
Yes,
if that
please
works
do.
for you. And thank you for walking through all of that. Really, I think it's so important to remember that there's all of these different components to workforce well-being. And hi, everyone. I'm Sydney Axelrod. I'm also a member of ACU's Star 2 Center team. And we got a great question in the chat from Wanda. Thank you, Wanda, that asks, are there standardized and vetted questionnaires to help health centers gather staff feedback on experience and needs? And really, our recommendation when we're thinking about putting together these staff satisfaction surveys or an employee engagement survey or anything of the like, is that there really is not going to be one size fits all answer for you here, right? There's not going to be one standard set that's going to make sense for your unique health center. So they can certainly be valuable as a great starting point. But really when you're crafting these questions, you want to think about those specific needs of your health center. Because if we're not sort of modifying and tailoring the questions to meet our unique staff needs, we might miss some really important things that they're experiencing. And I also want to just lift up that it's important to think about a mixture of questions as well. There might be some really wonderfully sort of well-vetted, closed questions that you might want to incorporate, but also think about including some open-ended questions as well, and really creating that space to gather both some quantitative and qualitative data. And just a little shameless plug about this, we have a lot of resources at the Star Center around building staff satisfaction surveys and responding to them. We actually have a learning collaborative coming up on just this topic as well. So really encourage you to poke around our website and reach out to us directly if you have more questions or really want to take a little bit of a deeper dive into really what goes into building a really effective survey to get you the best feedback for your organization. Regardless of what questions you're asking, just most important thing to keep in mind is, as Tanya pointed out, how you're communicating that opportunity to contribute feedback and how you're communicating with your staff. Transparency is really a powerful tool in your tool belt here. And then lastly, we had another question asking some best options for communicating benefits to staff and when should that happen? I think that's a really great question. And my quick answer to that is early and often. So as soon as you have a new hire coming in, right out the gate, I think it's a really great idea to start communicating right away all of those opportunities that are available, all of those great benefits. And as Tanya was discussing, it's really important to continue to remind folks about those. We all have so many plates in the air and balls in the air that it's easy to sort of forget that all of these wonderful opportunities are available. So early and often when we're thinking about benefits. And then lastly, there's one more question in here about someone's asking if we can talk a little bit more about taking a strengths-based perspective, especially for staff communication. I think that's a really great question. We don't have a ton of time to get into it, but Tanya, do you have any thoughts on a quick response to that one?
Ooh, I feel like we could do a whole training on strengths-based
I know.
perspectives, but I think, feel free to jump in as well, Sydney. I think my short answer is, when you're preparing to have a conversation with someone, trying to think and kind of view it from the other perspective of, does this sound critical? And if so, for what purpose, right? How are we highlighting the strengths and the values that everyone does bring rather than just cutting them down? And I know sometimes we have to have hard conversations about, performance and the ways people show up, but framing those things in terms of, our hopes for the strengths that we see in people, if that
Yeah.
makes sense. I don't know if that.
Absolutely.
Yeah.
I think, for a very quick explainer, I think you hit the nail on the head there. Really think it's really this idea of reframing our communication and how we're thinking about these things, right? So is something a problem or is it an opportunity for growth? Right? That's a really simple example of how those small shifts in our language and how we're approaching things as opportunities for change, for growth, really leaning in and leveraging the skills of our employees and the strengths and skills that are already available to us, as opposed to just focusing on what went wrong or what needs to be fixed. So that's a very quick answer, but certainly happy to chat more about that. And I do see some additional really fantastic questions coming in through the chat. And since we are out of time, I'm going to ask you all to please hold those questions, remember them, and we are going to send you off into some breakout rooms to continue this conversation. And I really encourage you to bring these questions to each other because I think there is so much valuable knowledge in this room here today between all of you. So I'm just going to pass it over to Megan to just give you all a quick explanation of how to get over there. But thank you so much, Tanya, for such a wonderful presentation.
Yeah, thank you all for having me.
Thank you, Tanya, and thank you, Sydney. So for the next 20 minutes or so, for those that would like to participate in breakout groups, you are welcome to join the following Zoom link shown on the screen. And I'm also going to pop it into chat as well. Again, if you want to join the breakout groups, please use the Zoom link in the chat or click it on the slide. You will be in here for about 20 minutes or so. Mariah Blake and Michelle Fernandez Gabilondo is in that meeting, so they will put you into breakout groups and you'll be answering the following 3 questions. What are some promising workforce well-being practices you have seen implemented? Which of the 4 pillars of well-being needs the most attention in your organization? And what are some of the ways your organization might be able to address that? Again, thank you all for joining this presentation. We welcome you to hop onto those breakout sessions and then return back to this main webinar at 3 p.m. for our panel presentation on AI and health centers. If you have any questions, feel free to put those in the chat. Thank you.
Hi, are you able to hear me?
Hi, Allison. I could hear you.
Hi.
Sorry, I was chewing.
No, that's okay. I was just nervous because
no
my
worries.
phone has been, my computer, I think when I switched between meetings, I kept losing my microphone and I kept forgetting which one was for which meeting.
No worries. And then if you want to just test your video real quick, you'll be all set to go at 3.
Yeah.
Beautiful. Awesome. Yeah, so if you would like, you still have a few more minutes, so feel free to turn off your camera and audio and just join us back at 3 p.m.
No
Awesome.
problem.
Thanks,
Thank you.
Allison. Thank you.
Yeah, that worked out well. Looking good. Megan, I did put some references into the host and panelist chat that might help answer the question about the data we received. And I let Sydney know, I'm sorry, Sydney, I let Sydney know too, if we want to use them at any time or in follow-up.
Great. Awesome. Thanks, Katja. Hi, Renee. How are you?
I'm doing well. How are you doing?
Good. Thanks for joining us. And your audio sounds good and your video is working. We have a few more minutes till the panel gets started. So if you want to go off mute and turn off your camera, more than welcome to. And hi, Stephen.
I'm good. Can you hear me okay?
I can hear you okay. Thank
right.
you.
Perfect. I was putting into the chat to host and panelist, hey, I'm here. And then you switched me over. So
Yes, I saw you. I've been scrolling, so I figured that. But thank you so much for checking. Hello, Jillian.
Hey there, how are you?
Hi, good. Your audio and video are working, so you're all set if you want to go off camera and off mute for the next 9-ish minutes.
All righty.
Thank you. Awesome. Thanks.
Can I ask one question?
Absolutely.
I'll be able to share my, go ahead.
Yes, everyone, you can share your screen.
Great.
I was just saying, everyone is still on the webinar. Some people are in breakout groups, some people are in break. I wanted to make sure it wasn't sensitive. But yes, you can share your screen.
Okay, I will plan to do that when the time comes.
I'll make you co-host too, so there's no problems.
Perfect. Thank you.
Awesome. And Tom, I see that you're here. Do you want to test your audio and video really quickly?
Yep.
Awesome.
Hi, Megan. How are you?
Good. How are you?
Good. Thank you.
Awesome. Thanks for joining us. And same thing as Jillian, for the next 8 minutes or so, you're welcome to turn off your video and go off mute until we go ahead and get started.
Okay, sounds
Thank
good. Hey,
you.
Katja, how are
Thanks.
you?
Good. Hi, Tom. Thanks for joining us.
Oh, of course, my pleasure. Anytime.
Yeah, nice to see you.
You too. Thanks. Oh, and by the way, I won't be there this fall. So we are actually going to Alaska and having a family trip, and so
Oh,
I'll see you in the spring
yeah. So meaning at the CHI or
at the CHI. I won't be at CHI.
maybe you'll be at the workforce conference.
Oh yeah,
But-
absolutely.
Oh,
Okay.
you will be very missed, but I'm
Oh,
so
thank you.
happy for with you.
Thank you. Yes. Well, it's good to
Enjoy.
meet you.
Okay, bye, Tom.
And just as a reminder for our attendees that are on the phone with us right now, thank you for joining us. Right now, we are still in a break until 3 p.m. And at 3 p.m., we'll officially get started again with our AI panel. So thank you for joining us. And just as a reminder, I see some folks just raise their hand. If you could just put all questions or comments in the chat or in the Q&A function, that would be great. Thank you. Wonderful. And it is 3 p.m. Eastern time. So welcome back, everyone. I hope you all had really wonderful conversations in those breakout groups about workforce well-being and also had some time for a break as well. From here, we're going to dive into our artificial intelligence in health centers supporting the workforce panel. Today's session will be moderated by Jillian Massini, the project director of JSI and the High Tech Center. And we'll have 4 panelists as well, which are all representative of health centers from across the nation. We'll have Allison Conley Flores, the Chief Medical Information Officer from Urban Health Plan in New York. We'll have Dr. Renee Crinchlow, the Chief Medical Officer at Codman Square Health Center in Massachusetts. We'll have Stephen Little, the Assistant Vice President of People and Culture at Evra Health in Florida, and Dr. Thomas Stevens, the Chief Medical Officer at Westside Family Healthcare. From here, I'm going to pass it off to our moderator, Jillian Massini.
Hey everyone, and thank you so much. Give me just a moment to pull up a couple of slides. Look at this esteemed panel. I am thrilled. We might be missing one person being highlighted, unless I'm not seeing it, in which case. All right, so as Megan said, here is where we are going. We are talking artificial intelligence in health centers supporting the workforce. I'm thrilled to be part of this summit and to be here with this panel. I'm going to give just the quickest thumbnail sketch about the High Tech Center before we jump on into our questions. So I'm the director of the High Tech Center. We're an NTAP, just like many of the other organizations who have been supporting this summit. And our specific focus is providing TA and resources for the effective use of health IT, EHRs, and data, aiming to enhance the quality, security, and documentation of care while maximizing value. We have a national website, which is hightechcenter.org. You can find us on LinkedIn. Everything we do is free to health centers, and it's just an absolute joy to be involved in things like this. And we work in lots of topic areas, including privacy and security, cybersecurity, security risk assessment, advancing interoperability, electronic patient engagement, readiness for value-based care, and many other things. All of these impacted by AI these days, and AI obviously a huge area of focus for everyone, including health centers now. If you are interested in more discussion of technology in health centers, do point your phone at this QR code or go to our calendar. Again, lots of health center focused TTA, free webinars, all sorts of things. We have a series with an attorney coming up where we will cover some of the regulatory and legal considerations related to AI. And so join us there if you're interested. And without further ado, I will get us into our conversation. Megan said all of this already, so I will just move us ahead. I think I do want to start with just the quickest of intros from each of you. Again, just a way to make sure everyone's microphones are working and that I've got you all here. So I'm going to start at the top, and I'm going to start with first names. Let me know if that's not how you want me to do it. Renee, can I start with you?
Yes, you can. So Renee Critchlow,
yeah, go ahead.
Chief Medical Officer, Codman Square, Boston.
Awesome, thank you. Tom, how about you?
Yeah, Tom Stevens. I'm the Chief Medical Officer at Westside Family Healthcare in Delaware.
Awesome, thank you so much. Stephen?
Hey, good afternoon, everybody. My name is Stephen Lytle. I serve as the Assistant Vice President of People and Culture with Evra Health, and we are located here in the Gulf Coast of Florida.
Awesome, thank you. And Allison?
Hi, Allison Connolly Flores. I'm the Chief Medical Information Officer at Urban Health Plan in the Bronx,
Amazing.
New York.
Great. So our first question here today is, what were the key factors that influenced your health center's decision to adopt AI, and how did you approach the implementation process? Who wants to get us started?
I could start. Oh, go ahead.
Allison, go ahead.
Okay, sure. So I would say really there's several reasons that influenced our decision to look for different AI technologies. I think we're always looking to improve patient outcomes, improve patient access. That drives a lot of what we do. I'm sure similar for my colleagues here. We also like to try to improve operational efficiencies whenever we can, and we like being innovative. So we've done a few different projects over the past few years. To just get into this space a little bit.
Awesome. Stephen, you want to build on that?
Yeah, sure. I think one of the key factors for us is really just we've always been a very innovative health center. We're always trying to find ways to get ahead and trying to make sure that we are creating efficiencies, right? As health centers, we're always doing as much as we can with as little as we have. And
Yes.
so, I think obviously we're trying to find out how can we streamline work, how can we create efficiencies. I think where Evera Health really shines is in the HR space. And I notice here that I'm with 3 chief medical officers, right? So my view might be a little bit different today. But first at Evera Health, we started by creating an AI governance committee. That committee includes our C-suite, myself, our frontline providers, and even one of our medical residents. And ideally, what we want to do is make sure the voices shaping our AI strategy reflected the people actually using the tools, right? Not just the leadership or the IT team. And so we've worked closely with our managed service provider, but also internally with this committee to set the tone for both responsible use and ethical guidelines, but to also set the tone for how we integrate tools in a way that supports our workforce. So for us, we've been really big on upscaling as a priority. We do lunch and learns. We built peer-to-peer champions and take a really supportive approach to peer management, right? We want to make sure that we're recognizing the things that we've done successfully instead of just throwing tools at people. We want them to see the value in it. We want to see how it applies to their daily work and build their confidence. And I think one of the most innovative ways that we've done that to create excitement about it was our leadership team developed what we called an AI Shark Tank. And that was an innovation challenge where cross-functional teams on our leadership team pitched ideas on how we could use AI to solve real-world problems that we're dealing with in our health center. So it was interesting because it got people engaged, it got them to think creatively, and it really showed innovation can come from, I think, anywhere in the organization, right? Not just our IT team. And ultimately, I'll say this, on the HR team, we led by example. We've used tools ourselves. We talk about what's working, what's not. We're very transparent. And because for adoption to work, it's not enough for us to tell people, hey, AI is good, but we really have to help them experience how it's making their work better.
Absolutely. Go ahead.
I can probably piggyback on that. I think that both Allison and Stephen have spoken a lot of the sort of the foundational is, what is it you're trying to deal with? What's your outcome? We're looking to improve patient outcomes, improve patient access, and understanding that AI is a tool, but you have to decide on what it is you're trying to engage that tool with. And clinical support and operational efficiency are critical. I love hearing my fellow community health centers talk about innovation. I don't think I've met a community health center that isn't at the forefront of innovation, just because we often have to do everything with nothing, and finding ways in order to do that is critical. And right now, one of the areas that we're seeing is the impact of the potential use of AI as a tool, as a multifunctional tool in that. And so really engaging proactively, understanding that, does your organization have an AI policy? Does your organization have an AI governance format? Does your organization have a pathway for someone who is one of your employees who wants to use AI in some way? Is there a pathway for them to do that? Because if there's not a pathway for them to do that, they're going to do it anyway, and it may, in fact, have some negative consequences on your organization. So upskilling your workforce, creating a governance framework for AI, and outlining what your goals are going to need to be. And part of our big drive was the moral injury around the abusive amounts of administrative tasks that our clinicians have to engage with. And that was one of the early drivers in us engaging with AI. But in doing the initial engagement, even about bringing in an AI scribe, we found so many more particular pathways for us to use AI. And I have to say that clinical support is a critical part, but operational efficiency is going to be so much more important for us because it's going to allow us to shift the dollars in our organization from the framework of our financial operations into the framework of our clinical operations. And that's going to allow us to have a much more robust sort of total clinic approach. I look at where the big impact for us is going to be is in the long run, making our financial and operational areas into very lean, with honestly probably fewer positions that are filled by people. We're not going to be cutting anybody, but the fact is those positions are often very hard to fill.
Right.
And those are a lot of skill sets that AI can do faster and more effectively. I mean, imagine 100% review of all of your claims and a 90-second return on the denials with machine learning so those denials don't happen next time. I really think a big part of it is going to be shifting the operational dollar into becoming the clinical dollar so that I can do more with my clinical care and less with my financial operations.
Yeah, great. Tom, what about you?
Yeah, Jillian, I would love to say that we were super deliberative and that we had developed this great strategic plan for this. But honestly, about a little over a year ago, we were in the middle of beginning to have those conversations to say, how are we going to govern AI? What use cases should we have? And what we found out was that one of our providers was already using an AI scribe tool without us even knowing it. And so we're like, okay, we need to step up the game. We need to really come up with a plan. So the first step is that we did a survey of our staff to see whether or not they were already using AI and in what ways. We've got about 240 employees. We didn't have a great response. Only 41 folks responded. But of those 41, 16 of the staff members were already using AI in various ways. AI Scribe, they were using it for generative AI for creation of documents and things like that, including patient education stuff. So we realized that, the cat was already out of the bag. I mean, I think at this point, AI is just this tsunami. You're not going to stop it. You're not going to prevent folks from using it. And so what you need to figure out is how do you control it to some degree? How do you make sure that it's being used responsibly? So one of the things that we did was we did an all sites meeting back last July, I guess it was, for all of our staff, explained to them what AI was. Some of them at that point didn't know anything about AI. Some of them were already using it for other things, but really explained to them, risks with HIPAA, with information going to the cloud. And then we expressed to them where we thought it was reasonable for them to use it for right now, and then let them know that we were continuing to explore it. And with that, we began to do a pilot with the AI Scribe. We looked at it to see if we felt it was accurate enough, what was the impact on workflow, and then we engaged in doing a BAA and really making sure that we had all the HIPAA aspects covered. So at this point, I think we've got a much more deliberative process. We've got some real good use cases, but early on it was really just reacting to the fact that it was already out there and the staff were already using it.
Great. So I'm just going to summarize what I heard from you all and just encourage you to react to any themes that come out in this. So when we think about the key factors that influenced it, I heard, we sort of know this is coming. The cat's out of the bag. We can't stick our head in the sand is one of the ways that we talk about it. The really key need for health centers to be innovative because of the need to do so much with so little, which I certainly think is always relevant. That there needs to be a pathway for someone to be able to use the tools that are available in the world without sort of fear, without consternation, that sort of thing. I think Renee and Tom, you both mentioned that, that the administrative expectations on health centers are so huge. I think Stephen and Renee, you both mentioned this. And then that, you know, sort of people are using it anyways. And so some of the ways that you mentioned approaching implementation are some piloting efforts. Several of you mentioned AI governance, which I think is fantastic. And I'm really curious how that interacts with data governance processes, that sort of thing. The AI Shark Tank, sort of thinking about the problems that exist and how you can respond to that. And then really the need to have AI do things that we must get done, but that we simply don't have unlimited dollars or an unlimited workforce pool to draw from. And we're sort of looking for it to step up into some of those things. So what of those themes, anything I've missed, anything else you would add on this question here?
I would just reinforce, I think what Thomas mentioned. You can't hide from this.
Yeah.
This is coming. This is here, and it's important to create a pathway for our people to be able to succeed in doing this in a way that just also protects the patients, their fellow colleagues and workers.
Yeah.
But that this is not something to be afraid of. This is something that we need to necessarily engage with. I look at the EHR as one of the most evil things that has ever been developed because it was designed for billing and it was
Right.
designed without clinicians in mind, and it was just good enough for physicians and clinicians to kill themselves. And I'm not joking about that, and I think it's very bad. We need to be involved in the development of AI, or we're going to have another EHR nightmare. So we can't hide from it. We need to be involved in it, and don't be afraid. Ask the questions and engage.
Yeah, absolutely. Anything else that anybody, Allison?
Yeah, no, I think just adding to what everybody said, it's really slightly different, but really not all that much different from approaching any other type of project. I think this was already touched upon. Definitely having a multidisciplinary team because it is going to affect everybody. Everybody should be involved. Clinicians, administrators, IT people, staff to help with stakeholder engagement. So I think that is critical. I think also having a prioritization process. What's the most important item? Because it is scope creep, I think is happens a lot. And it's hard to do everything well. So just having a project, finishing it, seeing it through, making sure it goes as anticipated, making sure staff is trained and reporting on how you're doing. So similar to other projects, I would say.
Yeah. And that need for prioritization process. I'm writing that down because I missed that the first time, and I think that's a great point as well. So can you share, for example, both Stephen and Renee, you have really highlighted like areas in your clinic where the workforce sort of demands AI as a tool. And so I'm curious if you can share examples of how AI has supported or enhanced your workforce. Sort of what have you started to see for outcomes? What have you started to see for what's worked? And Tom, I saw you come off mute. Go right ahead.
Oh, actually, I forgot to go back on mute.
Oh, okay, no worries.
But no, I'm happy to
No,
jump
go for
in.
it. Yeah.
So, I think that I mentioned that AI Scribe was sort of what really was our impetus, and that is still probably the most impactful use that we've got. We did the pilot. Our clinicians loved it. We've expanded it to all of the clinicians who want to use it. Not all of them have embraced it, but most of them have. Unfortunately, with our EMR system, we don't have it integrated. So it does require some cutting and pasting. Despite that, administrative additional task, they have still seen it as resoundingly improving their work-life balance and their interaction with the patient. I think that's the thing that, we started at thinking it was going to help with documentation, help them spend less time documenting. But the real thing that they have felt is I get to put my computer to the side. I get to focus on the conversation with the patient. I don't have a screen between me and the patient. And that has been huge. And that has really had an impact on their job satisfaction, and they're feeling like they're doing what they always wanted to be doing. So that has been so impactful.
So can I ask a quick question? Out of the four of you, how many are using ambient scribing or something like that? Okay, everyone, great. So I'm going to ask a specific question from the chat, and then I'm going to come back out to more general responses, as I know you all have great ones. So Wanda asks in the chat, how well does AI support clinical notes when caring for bilingual patients, especially those seeking behavioral health and SUD support, or substance use disorder support? The panel mentions use cases and quality checks. Any examples of this type of scenario? Go right ahead.
So I'll jump in on that real quick. I'll say that one of the things you have to realize is that the AI scribes are trained on a data set. And what you'll find is that languages that have a robust global impact are all excellent with my AI scribe. Languages that have a robust global impact, so Spanish, French, any of the major Romance languages, all excellent. Where we run into a huge challenge is we have the plurality of our non-English speakers are Haitian Creole speakers.
Yeah.
And Haitian Creole is not French. It is not even close. It has a common root, but it is not French. And so our Haitian Creole providers are unable to use our AI scribe. And so we have instituted in an act of equity different types of support to be in place for them.
Yeah.
The interesting thing is you can use our AI scribe also as a dictation format, and some of them are using it in that way. But any language that has a large global impact, Spanish, French, Arabic, we have had no problem with that. And we have our behavior. I've assigned champions from every department. So whether it's primary care, urgent care, BH, there's a champion that works directly with the AI scribe company to optimize the scribe for that particular platform. So our BH champion has worked very closely with the AI scribe company. And I've been really clear with the company. It's like, we won't stop until it actually works really well for all of these departments.
Yeah.
And
sure.
what I've been hearing from my BH champion is that they've been very responsive. And I got to tell you, as a clinician myself, I'm a family medicine doc, and I do mostly urgent care now because of CMOing. But it's so nice to sit in the room and look the patient right in the eye and have that conversation and not have to touch my computer.
Yeah.
And I'll leave the room and come back and just close out and I'm like, the patient will be like, I don't know what was different today, but this was so amazing. Thank you so much. And then to me, I'm like, it's because I'm looking you in the eye and I get to see you. And I'll tell you that the folks that were having the most interesting challenge in adapting towards it is a real generational thing. And it's the millennials who were trained in an EHR and they're very good typists. And they're like, I don't need it because I'm a super typist. And I'm like, I'm not forcing anybody into this. But the fact is, what we're doing is we're putting up all of the data on who's closing their charts in a timely manner and who's doing more pajama time. And the fact is, if you're typing in the engagement with the patient, you're having more pajama time. It's just working out that way. Because my folks that are doing the conversation, when they touch the computer, it's to add the orders. It's to do this. And so things are getting done sooner. And AI scribe is not going to solve all the administrative burden at all.
Right.
But it's an important
but it is going to
part.
help. Right.
So it's
Absolutely.
helped us. Yeah.
Awesome. Thank you so much. Allison, go ahead.
Yeah, I would just add to that. I think everything that was just said was absolutely true. And I sort of felt like a hypocrite because I was pushing it myself. And I said, oh, I can't use it. I've known these patients for 25 years. I talk about too many other things, their family, their dog, their kids. And one day I said, I just have to turn it on and see what's going to happen. And it was a particularly difficult case with a lot of drug use and maybe some not ideal decision making that was made. And I really forgot that it was on. And when I went back and had it transcribed, I couldn't believe the amount of counseling that I had done. I would have never in a million years documented a fraction of what the AI caught. So I think to that point, I think you're able to just have a conversation and not have your back turned, hovering over, trying to just type and finish the note. I think it really enhances. I don't think we're necessarily going to save a ton of time. But I think the notes are going to be so much more robust. I think there's going to be so much more documented that I certainly wouldn't have documented, probably because I just wouldn't have remembered all the things I said. And it articulated it so well. I also like to go back and show the patient because it does transcribe the conversation on the side. We could correct anything that was incorrect. So I think it's really a great tool, even for just engagement. With the patient to focus on the conversation and let them be involved really in the documentation process.
Yeah, great.
Yeah.
Stephen, go ahead.
Yeah, I was going to say at EverHealth, I mean, we're absolutely using tools like DAX for provider scribing. I know it's common across health centers, right?
Yep.
And in fact, we're even looking at a proprietary program for translational services because we spend about $360,000 a year in translational services. And if we can work on this program, we're actually projected to cut that cost by about 80%. But I think what really sets us apart is how we've embedded AI into our people strategy, especially in HR and operations, right? And so I'm not going to gatekeep. I'm going to tell you guys all the different things that we've done because I want to see other people drive their missions like we are. So, first, we've leaned really heavily into generative AI to improve how we train, communicate, and we really support the workforce. I think one standout example is our use of a program called Synthesia. It's an AI-based avatar platform. And so we've really taken this out-of-date, text-heavy PowerPoint trainings and transform them into these engaging multilingual videos that have custom avatars of our leadership team. So that's been really awesome because it makes the experience more human, more accessible. It makes it more efficient. And the avatars for our leadership team, we also use to create communications to the workforce. And that's been one of the biggest challenges that we've seen through our engagement surveys is that communication downwards, right? And to get a production team for video and to build a script, we can now do that through avatars that look and sound exactly like you're seeing me on this screen today. I think when I think about our leadership team in general, we have a leadership team of about 40 if you include all of our directors. We've used a program called Notebook LM. It's by Google. They don't use any of your information to train their data, but it summarizes complex reports into these really simple podcast style audio briefings, right? So if we've got 30 departments providing information about what's going on in their organization or they're part of the organization, it can connect the dots between all of those reports and create a 2-person, 30-minute podcast that you can listen to on the way to work or on the way home, and you can understand where we're at as a business during that month, connect the dots between departments, rather than having to sift through 30 reports, trying to figure out, okay, what's important? What do I need to take away here? So I think it's really important, especially for leaders who don't have time to read through every single report in detail. We've used AI as a major shift in our contact center, where we've used AI with what's called Talk Desk. It has reduced talk times. It's improved patient scheduling. It's cut down our no-show rate. It's not really just an operational win for us in being able to reduce headcount in the contact center, but from a patient experience or schedule optimization, I mean, it's supporting both access and team efficiency there. And then I think, generative AI in general, whether you're using ChatGPT or Copilot, we've helped build our employer value proposition. We developed an entire core competency framework from everything that supports the employee lifecycle, from hiring through separation and development. We've just launched a brand new compensation strategy using some of the deep research tools in generative AI. And so I think, I tend to think that people look at generative AI as, hey, it creates this content for us, or it can do these little things or answer questions, but it's advancing so quickly, and the amount of impact that it can have on strategy within an organization is completely transformational, especially in a department like HR that's typically looked at as transactional or supportive, and can now really transform an organization's workforce.
Yeah, absolutely. So 2 specific questions coming up. Oh, go right ahead.
I just want to add a couple
Please.
quick Renee's comments. One, Renee, we've got a large Haitian Creole or Haitian population as well. Haitian Creole, likewise, we've not had success with. One thing though, none of our providers speak Haitian Creole, and so we're still relying on language interpreting services. And that's one thing that has been successful is even when you've got the patient, the provider, the interpreter, you can still have a good visit that gets scribed and is usable and accurate, even if the scribe itself does not sort of speak that language well. And then the other thing I just wanted to mention is that we actually aren't using it except with our medical providers. We're not using it with behavioral health. And I just wanted to highlight that because there may be other health centers that are sort of facing that same issue of, it comes with cost. You've got to pay per provider for AI scribing typically. And so we recognize that the folks that were spending the most time working after hours were the medical providers. And the behavioral health providers, it wasn't as big a thing. They already seemed to have very good conversations without the EMR getting in the way. So we've not used it for, say, nutrition or for behavioral health, and really have focused just on our medical providers.
Great. And that's super helpful that even if you're bringing an interpreter in through sort of a legacy approach, the AI scribe can still be useful, because there were a number of questions and comments in the chat about what about for ASL? What about for tribal languages? Go ahead.
As long as one person in the room is speaking English, you're absolutely fine. As long as one person is speaking English out loud, you're absolutely fine.
Perfect. Awesome. Thank you so much. So a couple other specific areas of questions that are coming in. One is, how are folks dealing with the education and engagement of the other party, right? So Stephen, in your examples, the staff are getting, so for example, the videos with the custom avatars or the podcasts or audio summaries. For others, you may be using more patient-facing things, and the patient needs to know about AI and its role. How is that playing into this?
Yeah, I think, what I really look at with AI specifically is change. It's change management, right? And most people don't like change. Like, people, if we use a program called Monday.com for project management, has a ton of automation, a ton of AI built into it. And for those on the call, you get free licenses, up to 10 free licenses of Monday.com if you're a nonprofit. So go sign up for it, test it out, see if it'll be a good use case for you. We've used it in so many different ways across our organization. We replaced our HR ticketing system. We built requisition dashboards through it. But what I would say is, it's just like if you give somebody a treadmill, right? You can give somebody a treadmill, but if they never get on it, you never motivate them to use it. You never tell them how to use it rightly, right? You never celebrate when they're on it. They're never going to use it, right? It's changing behaviors. You've got to celebrate it and get people to actually change their behavior. And so for us, I think outside of our governance committee, which tries to find use cases, we're really celebrating at the leadership level when we see people using AI effectively to drive change in the organization, to drive efficiency or whatever it may be. And so, part of that is also, for DAX, when we rolled that out, you guys all talked about how some people were like, yeah, I'm good. I'm millennial. I know how to type fast, right? But it's about getting champions. Okay, let's find the people who have influence in the organization. This works in any change management process. Let's teach them how to do it. Let's bring them along, and then they can influence their peers and say, hey, check this out. Let me show you what it's done for me, so they can see the value. And then I think the biggest thing, especially, for us, generative AI is a big tool for us. It's encouraging people to use it outside of work too, right? Like, I use generative AI to tell stories to my daughter at night, to draw pictures, like take pictures that she draws and bring it to life, all because that teaches you how to use it effectively and prompt and to get outcomes for it. And so I think for us, it's really about training people. We've had trainers come in from, different private trainers. We do lunch and learns. We celebrate wins. We talk about how we're using it. I think you've got to find every way you can to find adoption for it, because people are going to be hesitant to change. And so if you can show them the value, you can make it easy for them. I think you're going to see an easier integration.
Yeah, absolutely. Go ahead, Tom.
I want to speak to it from the other side, from the patient side. You know, when we started using AI, we were concerned that patients were going to be very nervous about it, that they were going to really push back. And you know, so we started out when we were doing our initial pilot, having conversations with the patient, explaining to them what we were doing. And, you know, pretty much uniformly, they're like, that's fine. It's, you know, and so one of the things that we've really, or there's two things that we've really done that I think are really important. One is we've normalized AI. It's just a part of our care now. And I don't think that, you know, when we were first discussing this, we're thinking, well, do we need to give patients the opportunity to opt out? Do we need to tell them every use case where we're using AI?
Right.
Well, AI is getting embedded in everything.
Totally.
I mean, it's in the EMRs, it's being used for clinical decisions, you know, even the, you know, the labs outside of our system. So there's no way that you're going to be able to tell the patient every use case that's impacting them. So I think that, you know, one of the things that we've done is we've changed our consent form for patients that says that we do use AI. And then the other thing that I think is crucial is that we've stressed with our team that at the end of the day, the product that you're delivering, you are responsible for.
Yep.
So if you've created patient education that you used AI for, you need to review it and make sure that it says what you wanted it to say. If you're creating, you know, job descriptions, the same, I mean, you know, whatever it is, and if you're using it to help you come up with a diagnosis, ultimately you are making that diagnosis, and it's your clinical decision that's you know, ultimately on the line.
Yeah, and I'd have to reinforce that is, you know, a personal experience. My family has allowed me to use this example as one of our children, older children, went to his provider. We read the note through my chart that, and the note was just abjectly wrong. It said that certain people were in the room that were not even in the state, and it was very unfortunate for that gentleman who signed that note that I am who I am, because I gave a very robust editorial response in the patient portal about being an effective clinician means taking responsibility for anything that you sign your name to. And yes, if you use a scribe, you are still responsible for my clinicians don't write notes anymore. They edit notes, but that is an important responsibility, and that has to be taken to heart. And that's also part of the training that we as leaders need to be a part of being involved in. One of the things that, you know, as a family physician who also teaches family medicine residents and medical student learners, one of the things that I've been engaging with is open evidence. Open evidence is an amazing AI that has a closed field that it pulls from.
Yeah.
And what I've been teaching is whenever you're going to call a specialist, whenever you're going to do a referral, put whatever question you were going to ask them into open evidence and run through it critically thinking, and then send and then compare the answers. Because as the primary care physician, you're still responsible for making that critical clinical decision making. That's what we can do that AI cannot do, is the clinical decision making that encompasses the full understanding of the patient's, you know, humanity. And that is our role. That is why primary care will never be replaced. Because if we do it well, we are a partner with both the patient and the artificial intelligence in finding a path forward. But our critical thinking, our engagement, our editorial engagement is something we cannot just pass off. I appreciate my AI companions in the way that they help us, but I'm not going to outsource the humanitarian care of our patients to them. We have to be critical. We have to edit, and we have to engage proactively.
Yeah. So someone has specifically asked whether or not patients must consign a consent when using AI during dictation and other clinical facing events with patients. I think I'm hearing no. Okay.
No, But what I do is often I'll
Allison?
say,
Oops, sorry, hang on
I'll
just one.
say,
Ooh,
sorry,
go
just
ahead.
real quick. I'll
Yeah.
say, my phone is going to be taking notes for me,
Mm-hmm.
and I've never had a patient say no.
So
But one of the things,
disclose rather than consent. Is
yeah.
that fair? Okay.
But one of the things that I think is critical is the AI scribe that we have chosen does not keep the clinical information, and they don't train on the clinical information. And that's one of the reasons we chose that.
Perfect. Allison, go ahead. Thank you.
Yeah, I believe my understanding, and I'm certainly not an expert, that it's at the state level. So New York right now doesn't require a written consent. We do, as was mentioned, ask for a verbal consent or just inform the patient and make sure that they don't have an issue. I also have not had a case where a patient said, no, I don't want you to use that. And similarly, our transcription of the note is stored for 7 days and then it's erased.
Yeah, that's super helpful. Okay, and my last question in this area is cost. Who wants to talk cost, ROI? What are you willing to tell the people? Go ahead.
I'll be real quick on this. What I've been telling my folks is find whatever AI scribe that is HIPAA compliant, that has the language capacity that you need. And honestly, right now is the cheapest.
Right.
And don't sign a long-term contract. And we found, I have no financial disclosures, but we chose a scribe that gave us part-time FTE and full-time FTE differential, and also gave us a differential on our learners. Like our learners are not costing us anything. My goal was not to burden my providers with having to see more patients in order to pay for the scribe. So we got the cheapest one that was HIPAA compliant and that would work with us, promise to work with us until it's effective. And don't sign long-term contracts, because AI is going to be so different in 2 years.
Yeah.
I think that's a really big key learning there is don't sign long-term contracts, right? Because it is advancing so quickly. I think one thing I would call out though is that outside of scribing, it's such a big system, right? Like it could be as easy as, Notebook LM. I talked about the podcast thing earlier. It's free. It doesn't cost anything. It's through Google, right? But you also have different levels of ChatGPT. It's free. Not very good if you're using the free version. $20 if you want to use the pro version. It has levels of deep research and custom GPTs like we've created for manager training. And then if you pay $30 a month, you can get the enterprise version that offers more security, right? And that's individually per person per month. We're now testing out Copilot. Copilot runs at about $30 per month. And in my opinion, not as good as ChatGPT, but maybe that's because I've gotten used to it. If you have, T-Mobile, you can get Perplexity Pro for free, which is also a really great tool. So there's a lot of generative AI tools out there. In terms of cost, though, I mean, it just depends how deep you want to go. If you want to build large language models that integrate with your systems across all of your different systems and can address things like patient no-call, no-show rates or staffing challenges, like where you get really deep into large language models, you could work with a company that would probably cost you somewhere upwards of $20,000 a month. Now you have to look at back at that return on investment and say, okay, now are we having more provider utilization, less no-call, no-shows, right? We looked at that. Trying to remember what the company is called off the top of my head that we looked into that with. God, I'm looking at it right now. It is called Palantir. So Palantir is a big company, do a lot of government work. They started getting more into commercial work, but we looked at them about a year and a half ago. It was about $18,000 a month, but they would come do use cases for free and show you. But we couldn't justify that as a nonprofit healthcare center. We just couldn't justify that right now. Tampa General Hospital, who's here close to us, is doing an amazing work with it. Like, and they're building a center here to use for Palantir. So we're all in a different place as health centers. We have to do as much as we can with as little as we can, but you'd be surprised how much you can do with a simple paid for generative AI tool, not these really, really expensive tools that are out there. You just need good training and to learn how to do it.
Yeah, and I'm struck how several of the examples shared. So Nabla is the AI scribe, which is not within the EHR. Freed, which is not within the EHR.
No, Nabla actually can integrate into Epic.
Oh, I apologize. Thank you.
That's okay.
And then Sono in ECW. So a couple in and a couple not. And so sort of not like sort of using what's available, using what can integrate, and also using what's affordable and meets these other criteria. So I moved us forward to the next question because you all have really started to get into it. And I think it's a really good opportunity to get into the questions that are in the chat as well. And the question is, what lessons have you learned? What advice would you offer to health centers considering AI adoption? And excellent things, including don't sign long-term contracts. I think Stephen just said, think about things beyond the clinical scribe and what that can look like. What else? Allison, I see you off mute.
Oh, yeah, I just took it off. Not necessarily for this, but so I think as good as the technology is or can be, we still need people. I think any problems we've had using AI has not necessarily been an AI problem, it's been a people problem. So whether or not we didn't have enough staff to use the AI, so it's still, you still require people. It's just like we mentioned, elevating what people are doing and hopefully working to the top of your license. But still need people, still need to optimize workflows, figure out the best clinical process to follow. So I think none of those things go away. AI doesn't replace any of those things.
Absolutely. Yeah. What
Okay,
else? Go ahead, Tom. Yeah.
just a couple quick thoughts.
Please.
One, Renee had mentioned about, I think she was the one who said that they wanted to make sure to choose one that didn't require the providers to see more patients. I think that's one of the key things that was a takeaway for us too, and we did the same thing. We got the cheapest one that we thought was good and did not require them to see more patients or have any sort of cost sharing for them or anything like that, because we wanted this to be a real win. We didn't want them to see it as sort of, well, mixed blessing. So that's one piece. The other thing, Stephen had mentioned about about ChatGPT and the different levels, and I agree that the more you pay, the better the version you get. But even the free one, I mean, we're using the free for a lot of stuff, and it's doing just fine. And I'll give you two use cases. One is for job descriptions, when we're creating new job descriptions or revising old ones, just asking it to simplify. And it does such a great job. The other is that we're taking all of our policies, we're creating an online knowledge base, and with the idea that we wanted these policies not just to live in some electronic drawer, but to really be used. So I actually wrote down the script because I think it's helpful. Is we take all of our old policies, which used to look like legal documents, and we say, take the following information, write a simple procedure in plain language describing the process. Write it at a 12th grade language level, use tables or bullets if needed to simplify. And it is amazing how good, even using the free version of ChatGPT, that those policies are. We then have the team review it, revise it, improve it, make changes based on if there's workflow changes that have happened since the last time we revised. It goes through a couple more edits. We've actually run it through the GPT a second time, and that's been, you would think that, oh, it's already good enough. Well, it actually makes it better. And so we give it a final review, but those documents are now user-friendly, and people are using them to train, to use them as resources. So again, just to reiterate what Renee and Stephen said, you don't have to pay a lot of money to have good resources to be able to use AI.
Yeah, I mean, I think one of the biggest lessons we learned is, and me especially, is that AI doesn't fail because of the technology. The technology works. I think it fails because of people not knowing how to use it and how they react to that.
Right.
And so I think you have to build a culture of trust, support, and I think, you have to build an ability to train, right? And to develop people. You got to give people permission to learn and help them do that. Because it does feel intimidating if you don't have the space to learn it and experiment with it. And so the other advice I'd give, and I saw a couple questions come through of like use cases, right? Or if we're not using it yet, how do we use it? Start small and start smart, right? Don't try to do everything at once, right? Find a clear, if you're in HR like me, find a clear people-centered use case. Maybe it's training, maybe it's internal communications, maybe like Tom said, it's updating job descriptions or contracts or a specific HR process. and just make sure that you're aligning whatever that initiative is back to your mission, and bring your leadership team along. I think the leadership team gets away from the day-to-day work that we do that's oftentimes very much an administrative burden. And so share what you've learned, show them the work that you're doing, celebrate those wins. And I think you'll be able to get the buy-in for that and allow the organization to innovate and grow because of it.
Yeah, this is something that just piggybacks perfectly on the fact that community health centers are hotbeds of innovation. And now with AI and the engagement in AI, we have to be, proactively learning and engaging. Yeah. Our innovation is just natural. And the fact is, if we create the environment where we can all learn together, it's going to be better for our patients and our staff.
Absolutely. I see Allison has asked, has anyone used AI to automate the EHR training for new associates? Allison, anything more you want to say there?
No, I think there's just so much time and energy spent so frequently on doing this. I know, we have started making some training videos. I think there's I don't know how much we could automate, but looking to see if anybody has, I figured why not learn and see if anybody else has done something similar with avatars or something else.
Yeah.
The Google NLM or NLP, Google NLM, basically it takes whatever you want to teach someone. If you put it in there, it will make it into quote unquote a podcast where two people engage and discuss it. And I think it's a perfect format to do some level of sort of basic EHR training. And yeah, Google Notebook LM. I steer you towards that.
I also know that there's been a that some health centers are doing sort of like chart reviews, documentation reviews using AI. I wish I knew which folks are using, and that there's like a feedback loop process of that. That's like how to improve your documentation especially for newer staff.
Well, we're trying to do that with our, we're working with our finance department to work. This is one of my sticking points is that sometimes the folks in leadership are like, well, it's working fine. We don't need to change it. You're like, it's not working fine.
Yeah.
It's not working fine because you're only reviewing 10% of the charts. And yet if I'm asking one of these, 3 of these companies that I'm talking to can review 100% of the charts, you give feedback to the clinicians, and also immediately return any denials to the insurance company within 90 seconds, 100% of the charts. So it's like that kind of stuff my clinicians can learn from and get better. What we're doing right now is we're giving this one company over $1 million a year, and they review 10% of our charts. This is driving me nuts.
Yeah.
Don't tell my boss. Anyway.
They might be here, honestly.
Yeah, probably. Hi, guy.
Jillian, do you have any final thoughts before we wrap up?
Just nothing but eternal gratitude to the panelists here today. You all are fantastic. You have shared so much great information, and I so appreciate this conversation and the level of detail and depth that you've been willing to go into. Really appreciate it. What an honor.
Well, I echo all the thank yous, and thank you, Jillian, for being a wonderful moderator. I think we had 20 plus questions and we got through nearly all of them. And if we didn't get to your questions, you can still use the chat to connect with folks as well. So again, thank you to all of our panelists. And just to sum up, Renee, you had an excellent point of health centers are a hotbed for innovation. And I think we're going to see that in our next presentation as well. So thank you all again, and we're going to transition to our presentation on expanding access through dental training programs at health centers. So with that, just give me a moment as we transition. Fantastic. Let's go ahead and get started. So now we're going to kick off our presentation on expanding access through dental training programs at health centers. For the session agenda today, you'll hear a quick snapshot of the health center oral health workforce, and then we'll dive into a presentation on advancing dental workforce through the Dental Assistant Registered Apprenticeship Program. And then, as always, we'll have time for audience questions and some wrap up. Fantastic. And we have 4 wonderful presenters today. I'm going to have each of you introduce yourselves, and then we can also just make sure your audio is working as well. So, Candace, do you mind going first?
Sure. Hi, everyone. My name is Candace Shu Owen. I use she, her pronouns. I'm the Senior Director of Education and Strategic Partnerships for the National Network for Oral Health Access, or NOAA, and I'm excited to be here. So thank you for the invitation.
Fantastic. And Chessa, can you introduce yourself? Oh, Chessa, you're off. You're not on mute. You're on mute.
Goodness sakes.
There you go.
That's right. I'm Chessa Quinzer. I work for Community Care Network of Kansas. We are the Kansas PCA. I'm the Director of Recruitment and Membership.
Fantastic. And Lindsay.
Good afternoon. I am Lindsay Easley. I am the Manager of Clinical Education at Grace Med Health Clinic, as well as the preceptor for both of our apprenticeship programs.
Fantastic. And finally, Austin.
Hey, I'm Austin Russell. I'm the Healthcare Partner Advisor at Career Step.
Fantastic. Thank you. Awesome. And thank you all for joining us today. Just a reminder on the housekeeping, if you have any questions for our presenters today, please put those in the Q&A function. If you have any comments, I would recommend putting those in the chat. Feels like the chat is very robust right now, which is fantastic, but I don't want to lose any questions if you put them in the chat. So thank you all. And from here, I'm going to pass it off to Candace, who's going to give that snapshot of the health center oral health workforce.
Great. Thank you so much, Megan. And again, welcome all. Excited to be here with all of you. I'm going to provide a very quick snapshot of the health center workforce in dental workforce in health centers. So if we can move to the next slide. A little bit about our organization. So as mentioned, we are the National Network for Oral Health Access, or NOAA. NOAA is a national nonprofit membership association that provides support to dental professionals who work in the safety net. And we reference the safety net, we're talking about clinics that provide care to the most underserved communities. And we were founded by a group of health center dental directors in 1981 who identified a need for partnership, collaboration, and support. And pictured there on the right is Dr. John McFarland. He is considered the founder of NOAA. He passed away last year. So with all the work that we do, we're honoring him to really advance care for all. And we also like to highlight that this picture was way before PPE. So yeah, you can see that that was definitely in the 90s. Our membership now includes more than 5,400 dental professionals, which include dentists, dental hygienists, dental assistants, and partners. Next slide. NOAA is also a HRSA National Training and Technical Assistance Partner, or NTAP, like others that are on the call today. We are their oral health NTAP, so we provide training and technical assistance at no cost to federally qualified health centers and lookalikes. This slide includes some of those things funded by HRSA, as well as some other additional items that we have, like our annual conference, our Leadership Institute, and a listserv for dental professionals that want to connect with each other. So feel free to visit our website. You can also email us at info@nnoha.org. Next slide. So this slide is from the HRSA Uniform Data System, or UDS, and this is showing data from 2016 to 2023, and 2023 is the most recent data that we have, and we are focusing a little bit on dental assistants today, but you can see that there is a wide range of dental professionals shown here. So in gray, that's dental hygienists, orange dentists, and then blue are the other dental personnel, and that is lumped together. So that's dental assistants and dental technicians lumped into one group per HRSA. What we're looking here is the FTEs, the number of these type of professionals employed in federally qualified health centers over the years. And what we really like to look at is the decrease from 2019 to 2020. And you can notice that is obviously because of the pandemic, and the drop in the dental professionals that are being employed within health centers. The steepest decline is definitely the blue, the dental assistant category. And what is also interesting about the information that we're showing here is like the rebound from after the pandemic to pre-pandemic numbers, which is 2019. And you can see that it took us quite a bit of time to get back to the 2019 numbers. And so there's a lot of assumptions that we can make from this, that dental teams were severely impacted by the pandemic, and meaning that we saw a lot of dental programs close in comparison to medical programs. Many of them never reopened, and we continue to see some workforce challenges that are a result of 2020. And it wasn't until 2023 that we saw dentists and dental assistant staffing reach beyond the pre-pandemic numbers in 2019. Dental hygienists are still experiencing shortages. You can see that we're still not met where we were in 2019, which means that there's patients that are not getting care. Clinics are at shorter capacity. So we're looking at what can we do to be more innovative in our recruitment and retention, whether that is developing your own dental assistant training or maybe even other strategies to help better recruit folks. Next slide. We completed a survey in 2023 to help measure workforce recruitment and retention strategies, as well as job satisfaction, to help inform that type of work. And one thing that we are pulling out today are salaries, experience, and prior experience prior to working at a health center. And so this slide here is showing the years of experience in the dental profession. What's interesting is the majority of team members have 10 plus years of experience, especially dental leaders and dental hygienists. The NA indicates that they're not clinicians. You'll notice that that's the blue bar, so dental leaders. So that could be like a dental clinic manager that maybe isn't a clinician by trade. And we saw that 37% of dentists report 1 to 5 years of experience. So these type of things help to inform that many of the folks that are seeking employment in health centers are longtime experienced clinicians, but also that there's a gap in maybe reaching folks that are early out of school. So what are some opportunities to help recruit folks that are coming out of their dental academia? Next slide. So these next few I'm sorry, actually, this slide is going to talk a little bit about previous health center experience. So what were these folks doing before they held this current position that they're in? And we found that most of all survey respondents share that their current position is the only position they have held within a health center. So that's a couple of things, that they're getting hired and they're staying long-term, or they're making a switch from, say, private practice or a DSO or a different type of dental clinic environment and going into a health center. Also, some important information here is that 91% of dental leadership, so that's like a chief dental officer, a dental director, they rotated through a health center as a student. 60% of dentists rotated through a health center as a student, and 39% of dental hygienists rotated through a health center as a student. So again, maybe that's a strategy to help in recruitment. It's partnering with dental academic institutions to see how they could maybe do some extramural experience within a health center as a strategy for recruitment and retention. Next slide. So these next few slides are all graphs, and you'll get a copy of these slides so you can look at them in more depth. And this is national level data, and we're looking at current salaries of different team members. And this is always helpful to make sure that you're in line, that you're competitive, and just to see what the current market is like. So dental clinic managers, these are those that are not necessarily dentists or clinicians, and they're managing the dental practice. You can see that the most common salary for this type of professional was $60,000 to $75,000 a year. Next slide. We're looking now at executive dental leadership. So these are dental directors, chief dental officers. Most commonly, they're dentists. And so their salaries are much higher. The most common salary reported by this group was over $210,000 a year. Next slide. This is current salary for staff dentists. These are dentists that are not holding leadership positions within their organization. And so they are clinicians. They are providing dental care to patients. Most common salary seen $155,000 to $175,000 a year. Next slide is for dental hygienists. And this has more of a curve. You're looking at a range between 60 to 90,000 a year for dental hygienists. Also, many dental hygienists are hourly employees, which is that final bar at the end. And so you see the mean and the median there for dental hygienists. And then the next slide is dental assistants. The most common salary reported by dental assistants being 30 to 40,000 a year, with the average hourly wage being about $20 an hour. And what's important to note here when we're looking at dental assistant salaries in particular, that there are other salary surveys out there that are performed by national organizations like the Dental Assistant National Board to determine what the salaries are like for dental assistants nationwide. Those type of surveys are inclusive beyond health center dental assistants, unlike our survey. And year after year, we find that health center dental assistants are paid less than other type of settings, as well as they're not getting pay increases at the rate of dentists or dental hygienists. The next slide is indicating the factors of why people choose to work at a health center. We've been doing this workforce survey for quite some time, over 15 years now. And every single year, the most common reason that a person chooses to work at a health center is feeling a mission to the dentally underserved. There are other factors like work schedule, leave policies, benefits, and whatnot, but overall, it's always feeling a mission. So that's an important consideration when hiring. How can you identify mission alignment when you're doing interviews and whatnot? And the next slide are just simply recommendations. This is a very light overview of what's in our workforce survey and some of the workforce work that we've done in oral health. But these are some key recommendations that we've pulled out based on the information that we've gathered. Again, as I mentioned, identifying individuals with mission alignment, the importance of offering competitive salaries, regularly reviewing salaries and benefit packages. The salaries that we showed on the graph is national, but of course you want to counter for experience, location, what other type of clinics are around you, and doing a salary survey in your environment is really critical. Develop opportunities for professional development for all dental team members. Oftentimes we see professional development strictly in that provider group. So that's like dentists or dental hygienists. So how can you provide some career growth opportunities for dental assistants or dental clinic managers? And finally, we really encourage collaborating with community organizations, academic institutions, and other great partners to support recruitment and retention. And you'll hear from some really great folks today that have done some good work to help enhance the oral health workforce. This slide is just our full survey analysis. We encourage you to look at it. And if you're looking for some state-specific data, feel free to reach out and I can give that to you as well. And then the final slide is my contact information. I think we'll pause on questions and just lead into our next presenters so we have time, and then we can do some questions either through the chat and then towards the end of the presentation.
That's great. Thanks so much, Candace. Awesome. So from here, we're going to pass it off to our presenters from Kansas Community Care Network of Kansas.
Awesome. Hey guys, thank you so much for this amazing opportunity. We are just beyond excited to share our program. And, you know, Kansas is unique. I want to start that off real fast. We do not have a dental school here. We do have a few dental hygiene programs and some dental assistant programs, but in totality, when you look at other states, especially our size or, you know, that are similar, we really are lacking in the dental education area. So we noticed that, and that was on our needs assessment consistently, that dental workforce was really, really a challenge. So as the PCA, we said, well, we have to do something. What can we do? So we just started here quite a few years ago, working with Austin at Career Step to really kind of devise and look at a registered dental, a dental assistant registered apprenticeship program. Next slide. So again, you know, just saying on our needs assessment in 22, 76% of Kansas health centers reported difficulty in recruiting dental assistants. And here in Kansas, they don't technically have to be certified, although that is obviously standard and best practice that we want our dental assistants to be certified. Nationally, we are seeing that dental assistant jobs are projected to grow 7% by 2032. And then not only that, but we also saw in our needs assessment that our clinics in Kansas are seeing increased vacancy, reduced capacity for prevention and routine care, and then also just burnout amongst other staff due to the shortage. You know, as you all know, Kansas is rural, it has some rural and frontier areas, and they have been particularly impacted for us here in Kansas with the staffing shortage. Next slide. So why we decided to do registered apprenticeships. If any of you have registered apprenticeships, you already know all of this. It is just a unbelievable, and you know, I love that they talked about, you know, their hubs of innovation, because that was a perfect segue to what this is. This is allows our health centers to really have the opportunity to innovate and train in such a unique way, and with a model that really has an insane ROI. I mean, 92% employee retention. For every dollar you spend, you get $1.50 on return on investment. And not only that, the social benefit is $28 for every dollar spent as well. So just a really, really amazing structured training program. Next slide. So again, our solution here, grow your own. You know, I know that there is that saying that if you've seen one health center, you've seen one health center. But for here in Kansas, that's also remains true. So many of our health centers, we do have 21 across our state. They're very, very unique in their own right. And this system allows them to grow their own, create a pipeline of skilled, loyal members, because that's what we are seeing. And not only that, not just for your current staff to upskill, but also to hire outside hires and, you know, develop this pathway of dental assistants that get to train within your system and really drive that mission focus, right? So you get to develop that within these folks. So, and that also helps increase retention. I'm so sorry. The other thing that it does that I want to point out is this program reduces barriers to traditional training models, right? So they are making a living wage while they're going to school, or while they're training within your health system. So that reduces financial barriers, transportation, things like that. And so I know so many times we see that people just don't go to school because they need to work, right? And this really provides that solution for them. Next slide. So our program, again, like I said earlier, was really developed out of member response. Not only did we analyze this in our needs assessment, but we also created a focus group when we were able to meet with a strong team of staff members from our network clinics, and they all were in agreement that this was it. And they were so excited to engage with this and really take on this opportunity and make it their own. So again, like I said, for us, it was very, very important for us to develop this program and create this program as a customizable program where clinics had the autonomy to really make it their own, whether that be workflow or even competency and everything else. So we were so excited. And that's one priority piece that we were really looking for. Again, it's your grow your own model. It is thriving. That is such just a phenomenal word. I should have bolded it because it really is. I mean, how incredible to take something and have this opportunity to train in a way that really supports your needs, and not only yours as a clinic, but the needs of your communities that you serve. So that was really important to us. Next slide. So our apprenticeship partners, and I know this varies in every state, but for us, we just built this little team, and it definitely our power team. So when we were looking at curriculum providers, again, we needed something that was really customizable, and CareerStep was the answer for us. I've been, I think 2.5 years now, 2-3 years. Austin and I have been in partnership. It took us about a year to develop this program together once we kind of had all the pieces together. And then also we knew we needed an intermediary. Now I know there's some PCAs that's doing this work themselves. For us, in our clinics, it was more cost effective for us to use one of our local colleges. It's the Washburn Institute of Technology. We just call them Washburn Tech, but they have an apprenticeship program department where there was someone there that could do this intermediary administrative piece for us. And so that cost for them is $100 per month per apprentice, which we felt like was just a really great discounted cost where we could provide that service to the clinic. And then also have our intermediary to be able to do this program. For the clinics, their responsibility once the program starts is really for them to have a preceptor, right? The other thing is they need to they will actually employ that registered apprentice. So if that comes with benefits and tools or anything else, that cost is going to be in there. And the program itself, it does consist, and I know Austin's going to talk about this a little bit more, but they have their didactic online curriculum through CareerStep, and then also that OJT training. And then the skill acquisition comes from a chart, competency chart. Well, their preceptor will check them off once they've mastered that skill. And so it is a year-long program for us. It's 12 months. And then we'll talk about it a little bit more on the next slide. So yeah, you can see here, it's 290 hours of online didactic courses. That's all through CareerStep. The amazing thing about CareerStep is not only are they getting support from the PCA, and our intermediary and their clinic and their preceptor, but they're also getting support, wraparound support with CareerStep's online community. And I'll let Austin talk about that a little bit more, but our registered apprentices have seen a lot of success and support from that. The OJT is the on-the-job training. That's 2,000 hours. The preceptor and other providers within the clinic will work with them to check off some of those competencies. The interesting thing about that is that the employer, so you as a clinic, you will be able to, if they had, let's say they're already a dental assistant, but they're just not certified, and you run them through this program, you can already check off some of the things that they have mastered, and kind of, you don't have to make them go through that all over again. It really is just ensuring and securing that they have those skills and knowledge. The last piece of this is for them to pass their DA certification exams, and I won't read all that to you, but it's really great. And CareerStep provides a voucher for that. So that is included in your tuition cost. Next. All right. So for us, it was really important when we developed this program for our health centers to have a manual, to have templates, really just to, build all of those pieces to where they could take them and make them their own. And so within our manual, really, it has program description. It has every piece of what you would need to do for the didactic courses and the online or the OJT within your clinic, the training. There is also some amazing templates. So we built a program implementation plan. We built an apprenticeship agreement. So a lot of our clinics here in Kansas are deciding to go with a 2-year agreement that if they provide funding for them to go through this program, that they would stay with them and continue to work for 2 years. There's also preceptor duties and responsibilities. We wanted to educate and let them know what the preceptors would need to do. There is also, we're calling it DARA, but there's also a job description if you want to hire outside hires. And then we even included a 90-day onboard, because doing an onboard for a registered apprenticeship, there's some few caveat pieces that are really unique to the program, and we wanted to put that in there. So as far as the PCA, what we do is that we do provide monthly meetings, support meetings, where a representative from Career Step, our intermediary, and then our workforce development specialist, and sometimes myself, will meet every month just to check in with those clinics that are utilizing the program. It is a phenomenal way to really identify, to celebrate successes, first of all, and then second of all, to really identify challenges. Early in the program, one of our clinics identified that their registered apprentices were wanting to do some extra studying at home with their didactic curriculum, but they didn't have a laptop. So we were so fortunate that Washburn Tech said we can loan out laptops. So we were able to ship a laptop to them. And then we've done that with a few other apprentices since then. And it's been super successful. It's really reduced that barrier to technology for them to study while they're at home. So the Career Step, our state funding here for registered apprenticeships for nonprofit is $2,750. And so that's kind of the cost. And then Career Steps was able to meet us at that level to provide a discount for our health centers, because they know how incredibly valuable the work is that our health centers do. The other thing is Career Step not only has this amazing course, but they also do have preceptor training. So your clinic would be able to access that to help ensure that your preceptors are ready. Next one. Excuse me. So that is all I have. I am just so thrilled that we were able to roll out this program. I am more than happy to share our manual or to share our templates with any of you moving forward. But I have the pleasure of introducing the amazing Lindsay Easley. She is at Grace Med Health Clinic, and she has taken this program and just shot it to the stars. So Lindsay.
Thank you. So I love anything teaching and education. So when we started this program, it was right up my alley. I started as a support trainer for dental, and we needed someone to kind of take over the realms of education because we are becoming what is called a training facility. So I went from being support trainer to manager of clinical education, which is amazing. So I have a short little video that I would like to show you guys first, because it really gives you just a backbone of why these apprentice programs are so important. So I actually sat down with the doctor that I worked for, her dad and her, for over 20 years, just to get a good idea of why these programs are so important, as well as one of my apprentices sat down to explain to you the opportunity that she has been afforded by being able to be a part of this program that she wouldn't have had before. So I'll just let you guys watch this first, and then I'll get into my PowerPoint.
Great, Lindsay, I'm going to hit play. If you can't hear it, please just let me know.
I am honored to have Dr. Jacqueline Blyholder and Yuritsa Bravo here with me today. In case you did not know, I am Lindsay Easley, the manager of clinical education here at Grace Med. Grace Med is taking on a new venture of becoming what we are calling a training facility. In becoming a training facility, we are starting a medical assistant apprentice program and a dental assistant apprentice program. So to start off, Dr. Blyholder, if you can just give us a little bit about your background in dentistry.
So I am Jacqueline Blyholder. I have been practicing dentistry for almost 9 years, but I've done it my entire life. My dad's a dentist, my mom's a hygienist, my brother is a dentist. We've all just been part of the family. So something I've done and known about for a long time.
Okay. And I will also add that you are the two-time recipient of the Wichita's Best
yes.
Dentist of the Year. So that is a huge
Oh,
accomplishment.
Thank you.
So in being in dentistry your whole life, you know about employees, what makes a good employee, what you look for in an employee. What are some things that you look for when you're trying to find that great new hire?
Hiring is difficult. I've learned this over the last couple of years. It's hard to find people that are, what's the word I'm looking for?
Experience.
Experience is big. Yes. It's nice to find somebody with experience. There's a lot of people out there that are inexperienced and they think they can just jump straight into being a dental assistant. And you can office trained is okay, but it's so much nicer to find somebody that has the experience, that knows what they're doing, that knows the lingo. There's also always integrity, character, and things like that. But that's also, hiring people in general. That'd be anywhere.
Mm-hmm. So when you think about like 9 years ago, we had a program. We had the WSU Tech had the dental assisting program. We had where you had the girls that were trained, that went on rotations, that had experience in an office, versus now, unfortunately, here in Wichita, we no longer have a training program. What are some of the differences you've seen between staffing when you had that program versus staffing now?
Being a dentist, you're busy. You're busy all the time. And having to take the time out of your busy schedule of seeing patients, doing life, and having to train somebody, that is dollars, that's money. And if you can find someone that's already been through that training program, they're worth every penny.
Every penny. Okay. So what is the biggest thing you look forward to with having an apprenticeship program here in town? I know we've talked privately before about the things you look for, but what are some, maybe two of the biggest things you look forward to with being able to have your picking and choosing with an apprenticeship program?
I hate having to get online and having to put up a ad and then having to weed through the people. If there is an apprentice program out there that solid people are coming out of, it's going to be so much easier. So much easier to find somebody when you need it, or even just to find somebody to fill in, even if you don't need somebody right away. It's just at your fingertips. It'd be nice.
Huge
Yes.
difference.
Yes.
Okay. Now, for you, Yuritsa, give us a little bit of your background here at Grace Med.
Grace Med. Well, I had just moved here in May of 2023 from Japan. And I started working with Grace Med in early September. I started off as a patient representative.
Patient service.
Yeah, patient services. I worked front desk from September. And then Grace Med emailed us about this opportunity for the apprenticeship back in, I believe, June, the end of June or beginning of July.
Mm-hmm.
And I thought it was a great opportunity for myself for this, like I just moved back. I'm a single mom. Like I had originally gone to college to become a nurse, but then I got married to a military man, and then life happened, moving and whatever. And so I thought it was a great opportunity for this. And so I applied and I got it.
Okay. So for you, it was the chance to grow and become better. What was one of the highlights of this program? Because I think a lot of people don't know that with this program, are you still earning a livable wage?
Yeah.
Okay. So how does the program work for you? When do you do your studies?
During working hours.
Okay. So 8 to 5, I'm just going to explain to people how the program works. So on Mondays, 8 to 5, you're at your home clinic and you're doing all your online studies. Then on Tuesday, Wednesday, and Thursday, there are 2 other apprentices, and you all meet with me at our new training facility where we have our classrooms, and we work together. Then on Fridays, correct me if I'm wrong, that's your shadow day where you're able to shadow in the clinic. Okay. So this is a 12-month program where you're still living and earning a livable wage. You're getting a trade. And at the end of that, you'll be able to take your certification to be a medical assistant. Do you think you would have done this if you had to pay for this program yourself as well as still tried to be a PSR? Do you think you still would have done the program?
To be honest, no.
Okay.
Sorry.
So it is affording people the opportunity that want to better themselves to get a trade, because four-year school's not for everyone, but it gives people the opportunity to, number one, you're still going to be able to earn a livable wage. You're going to get that trade. You will have the support, because for the program, I'm what's called the preceptor. So the responsibility of the preceptor is to basically guide you through the program. Okay. This is an opportunity, especially for not just for the apprentices, but also for the doctors to be able to get the cream of the crop, because no other program is going to afford people, number one, the opportunity to work in a clinic while you're going to school, but then also have that on-the-job training. So any closing thoughts from either of you about the value of training programs? Yuritsa? I put you on the spot. I know. I know. But what do you see for yourself in the future from doing this program?
Well, Grace Med offers a lot of experience, not only aside from the actual apprenticeship. They hire people straight out from school, and they they do all these things like laboratory phlebotomy, actually going into patients. And I have a sister-in-law that she's a nurse, and she says that she doesn't even do phlebotomy at her clinic. And so I think that's a great opportunity that Grace Med also offers.
You can learn phlebotomy, you can learn optometry, you can learn
Optometry, yeah,
podiatry here.
podiatry.
There are so many different specialties that you can master here at Grace Med, because my motto to all you girls is, and guys, don't stop at where you started.
Mm-hmm.
You can be a medical assistant, but go further. Be an LPN, then from an LPN, be an RN, then be a nurse practitioner. Same thing with dental assistants. I did the same thing as you. I got married and I fell in love, and I stopped at dental assisting. But I still am able to come back to my true love, which is teaching. But don't stop at dental assisting. Go on, be a hygienist. And from being a hygienist, go dental school. Okay. So what are your final thoughts on training programs, Dr. Blyholder?
It's nice to have something like this. Like you said, 4-year school is not for everybody. And having a trade program to get somebody what their passion is and be able to teach them, and 12 months, amazing. I think that's awesome. There's a lot of things out there that aren't 12 months. They're 6 weeks. And 6 weeks isn't going to do it. You
No.
learn absolutely nothing in 6 weeks. It takes a while to learn any sort of profession, be it dentistry, medical, like you said, optometry. There's a lot of things, medical things involved that you need to be professional at and know what you're getting into, because you're dealing with people's health. So I think that's awesome. And you couldn't be learning from anybody better than Miss Lindsay over here.
Thank you. I appreciate that. You know, I have told people this is my baby, and I take teaching very seriously. And I think that if people really understand what we're doing here at Grace Med, it is a wonderful thing. The apprenticeship programs are the wave of the future, and this is where training will be. And we are honored to be the training facility for Wichita, Kansas. Thank you guys for joining me. I really appreciate it.
Thank you.
Okay, so that's a good segue to go into showing why apprenticeship programs are so important. So first and foremost, there's a lot of different programs, a lot of different avenues you can go through to train dental assistants. We have some of the areas where doctors are starting programs in their clinics, where they'll maybe on 6 Saturdays in a row, girls will come in and they'll get that crash course in dentistry, which, it fills some gaps. But the beauty of the apprenticeship programs are, number one, it lays for the students a solid foundation of dentistry. So we don't just start just right out the gate, you're sitting chairside. No. When they're doing that online curriculum, they are starting with learning the basics of dentistry, ground up, ground zero. What was the beginning of dentistry? How did we get to where we are today? The online coursework is going to be monitored by whomever you appoint from your staff as the preceptor. The beauty of having that preceptor is that person will be responsible for knowing that material that they're learning online like the back of their hand. So for me, that meant that for the medical assisting and the dental assisting program, I did those modules. I took the quizzes. I took every little online course there was to take so that I would be able to help the students the best that I can. Because if you don't know what they're learning, then that leaves some gaps for you as the preceptor, because you need to know, what are they being exposed to? What are some questions that are going to come up? How can I help them succeed and do this in the best way possible? And then you have the learning tools that you get from CCNK and Washburn. They have lab simulations, they have competency checkoffs. And then for you, the clinic or the preceptor, you have weekly check-ins with CCNK, where if you run into an issue or if you run into a problem, at that weekly check-in, you're able to say, hey, I've run into this. Do you have any suggestions how to get around that? But then it's also an opportunity for you to be with your peers and be able to give them those success stories or those things that you've learned, so you guys can have that support that you need. Next slide, please. So when you have the apprentice programs, first and foremost, it'll be in your clinic or in your office. You're going to have the prime selection of candidates for new hire. You won't have to worry about putting ads out. You won't have to worry about, oh, is this person going to work out? We got to train them the way we like to do things here. From the ground up, they are going to be in your clinic with your providers, getting ready to enter that workforce. It also produces a reduction in voids in coverage due to lack of staff because it's a very quick program. It's 12 months, but you also have to remember within that 12 months, they will be doing some shadowing. From shadowing, they will be doing the competency checkoff. So they will be a part of the clinic and be able to be a part of that workforce even before that 12 months is up. You'll also, at the end of that, have an increase in production. We all know when we're training staff, that means sometimes we have to reduce the amount of patients that we see. When you've got a program like this, it doesn't interfere with your training because that preceptor is like an extra body that can help you, that we don't have to reduce production. We don't have to reduce the amount of patients that we see. And then also having these trained apprentices, you're going to have a reduction in errors and increase in patient confidence in your staff. You know, we've all come across that one staff member or that one person that, you know, they kind of just make you worry a little bit, not quite sure what that skill level is. Having your own apprentice program that you, like Chessa said, you have full autonomy. You can adapt it to what works for your clinic will reduce that lack of confidence that people can have in your staff. Next slide, please. Disadvantages of untrained staff. We've all ran across this. Again, reduction in production because you're losing chairside time. Every time the doctor has to stop and explain something, or that room's not set up properly and that assistant has to get up. Every time I tell people, every time your bottom leaves the chair, money leaves the air. You know, because you're getting up, that's slowing down the doctor and we're reducing production. You've got an increase in operator error just due to that lack of knowledge that they have. That leads to a decrease in patient safety and safety of your staff. You know, that's of utmost importance, making sure that everyone is okay, that everyone stays safe. Increased clinical errors due to not fully understanding procedures. That's one thing I really, really love about this program is, like I said, it builds a solid foundation for really good dental assistants because they're going to learn where dentistry started, where we're going, and all the good things that are coming on the horizon. Not just sit down in this chair and I'm going to show you how to hold a suction. It gives them a good foundation. Increase in overhead due to errors. Every mistake is dollars. There's a decrease in patient confidence in staff when people are not trained correctly. Increase in stress for you, the provider, because you don't have any confidence in that assistant that is sitting across from you and that you're entrusting your patient care to. When you have no confidence in your staff, that means you're going to take on more responsibilities for yourself, which also increases your stress. Next slide. So with the Registered Apprentice Program, you have structured on-the-job learning, job-related education, wage progression. This is the biggest curveball to get people to understand the apprenticeship program. I actually have 2 medical assistants that are working. They are on the floor, but they are not 100% sure of their skill level. So they have both actually approached me and want to know, how can I be one of your apprentices? They've seen what we're doing with the apprentices, what they're learning, what they're able to do, and how that can get them where they need to be and be able to take their certification. So they're asking, hey, how do we do this? Initially, like I told them, you may take a small pay cut because there's a buy-in for them to be a part of this program. It's just not just a free education. There is a buy-in. There's a portion that comes out of their paycheck bi-weekly. Then they have to do that buy-in of staying on with us for 2 years. But during the course, the 12-month course, they do have those pay increases when they reach competency levels or we do checkoffs. So they do have that ability. Like I said, they're still going to earn a livable wage, and they will get to where they need to be as a CMA or a CDA. But in doing so, they have to always remember you've got that mentorship. And at the end of it, you're going to have those valued credentials. Obviously, here in Kansas, it is not a requirement to be certified, but I tell everyone, irregardless of what is required, do what is going to make you the best. And to be the best, take that test so that when you go in and talk to that doctor, you go in and talk at that health clinic, you can say, hey, I'm certified. I put the time in with my schooling. I put the time in with my studying to get this certification. Next slide. So for us, our classroom setting, on Mondays, like I talked about in the video, they're at their home clinic. The main thing that we do here at Grace Med is we do not allow them to be interrupted. They are going to college at the end of the day. They are learning. and constant interruptions to remove themselves from their learning to do clinical duties is just not acceptable for us. Now, for other clinics, that may be okay for you, but for us and for me, I really want to keep my apprentices on track. So in order to do that, I don't like interruptions for them. So Monday, when they're in their clinic, they all have a room that they go into and they do their studies. On Tuesday, Wednesday, and Thursday, they are with me. We have actually built a training facility here at Grace Med that has classroom, lab, computers, all the things that they need to be successful. So 3 days a week, they are with me. And then Friday is their shadow day. Like I said, when they're not in the classroom setting, they're in their clinic uninterrupted, 1 day of shadowing. We found out shortly after I took over the program that there was a little IT block. They had laptops. They could study here at work 8 to 5, but they all wanted to be able to study at home. Well, our computers are set up in such a way to where that wasn't possible. So I actually was able to get them laptops that they could take home. And then we had extra tablets here at work, and they were all given a tablet that they can also use to take notes on. So all things to help them be more successful. I found out once they started on A&P that we needed to have a course on note taking. So I did some research on that, took a course for myself, and then came in and taught it to them so they knew how to take notes. That's one thing you have to remember with a lot of the people that will be apprentices. College may not be something they've ever done. And in high school anymore, we don't have note taking. Most of these kids are using their computers. They're using AI to do stuff for them. But on some things, you need to have a piece of paper, you take some notes. So we did that to help them as well. Next slide, please. They have competency checkoffs. The beauty of the program, again, is autonomy. There are some checkoffs that were in there that were things that we do not do here at Grace Med. So we were able to take those competency checkoffs away and add in the things that we do here. So you can add, you can remove, you can do the things that fit your clinic. You do not have to stay just to the curriculum, no changes. You can make this program work for you. The online learning affords the students the flexibility that they need. Like you heard Yuritsa say, she's a single mom, she's working. Going to school every day and trying to work would not have worked for her. So this online learning will really target those people that truly want to do something better and just may not have had that opportunity. It's an on-the-job training-based program, meaning the modules are structured so that the online learning aligns with what we will do here in the clinic. They're not going to learn things that are unnecessary, but it's going to get them to where they can be a true asset to you in your clinic. There's hands-on lab simulations where they can go back, they can continually do those simulations where they're learning at their own pace and able to repeat them as necessary. Next slide, please. So selection process, how does that look for you? How do you get your apprentices? Here at Grace Med, we just sent out an all staff email. Let them know, hey, we are starting this program. This is what the program looks like. This is what the buy-in will be for you. And this is what the buy-in will be for us. They all put in applications. We reviewed their applications, their work history. Have they had any disciplinary actions within the last 12 months? Then from there, they came in and they were interviewed. And that's how we chose our apprentices. They've got to be in good standing. You know, obviously attendance, we don't want to have attendance issues, things of that nature. So you want to look at all of those things. The program is tailored to be on a 12-month time frame, with the bulk of that work being done online. I know here initially we started our program in August. I did not take over the program until October. Around December mark, we were almost 3 months behind. I am very, very proud to say that my apprentices now are on track and may finish early because they finally got that guidance that they needed and we were able to push through. The program outlines the timing parameters set out by CCNK and Washburn so that the apprentices stay completely on track. That's the importance of the preceptor. I try to stress, if you're going to start an apprentice program, have your preceptor in place before you start. That is a key component. Make sure that person's ready. They've got all the information they need so that your apprentices can be successful. There's also stipulations that are clear on the consequences of not completing the program. For us, we did have one apprentice that did not complete the program, and it was clear in the very beginning, if you do not complete, the clinic will have to recoup that money. So that is one thing you will want to be abundantly clear with your apprentices on so that they understand that. But at the end of the day, I am a strong proponent of apprenticeship programs. They are the wave of the future. This is the way to get good quality employees in your clinic and get the things that you need. It is a buy-in from everybody, but the reward at the end is insurmountable. It is what we need right now, because we're finding most people, four-year school may not be for them, but they want to have a trade. They want to be able to say, hey, I've got this under my belt, and in the future, maybe I can do more. But this is the wave of the future, and I'm very, very proud of what we've done here at Grace Med. I have one more person I want to brag on, one of my apprentices. She is an immigrant from, I always forget, anyway, amazing young lady, okay? Initially in the program, she was like, I don't think I'm going to be able to do this. Like, I have so many barriers. There's so many things I don't understand. Her and I have sat together after work, before work, at lunch, and she is actually my top student now, and just sent me an email a couple of weeks ago. She is going to go ahead and pursue her education. She was able to get her college credits transferred over to a school here, and she is actually next fall, not this fall, but fall 2026, going to apply to medical school. And I am so abundantly proud of her, because she said without this program, she would not have realized the potential that she had in herself. So I appreciate you guys listening to me. I don't think I had another slide, but if I did, next slide.
I guess I can jump in from here then. Kind of tough to follow that up. And obviously we wish that all of our partners had a Lindsay and had a Chessa. Not everybody does. So best practices and everything that she just covered, if you can, jot it down or go over that toolkit, reach out to Chessa and have her send it out to you. That's really got kind of everything you need to kick off a program and be successful. But that being said, the Career Step program is set up originally to be direct to consumer. Like the majority of our learners were going through the programs on their own, at home, at their own pace, paying for their own courses, going and doing externships. And, we heard from the apprentice at Grace Med that that's not possible for everybody. People have kids, they've got full-time jobs, they've got other stuff going on. So this apprenticeship model is awesome because it's a job from day one. They can learn at work. And some of these employers are using it for their current employees. They're already working as medical assistants to give them a path to getting certified. Like I said, not everybody's got a Lindsay where they can, set aside a classroom and come up with computers and tablets and get creative and all this additional stuff. Sometimes they can only give them a couple hours a week to study, and the rest of the time they've got to, be working their regular role at the health center. So the Career Step program, the idea here, if you kick over to the next slide, we want to set up these really affordable, easy programs, not necessarily easy for the learner to skate by, but easy to implement as an employer. The slide that you're seeing here, this is all just pretty familiar stuff, probably beating a dead horse to anybody that's on this call and tried to hire dental assistants. But the programs that used to exist, they either don't have the program anymore, or the program class sizes have shrunk and they can only, churn out maybe 10 dental assistants here and there. They're kicking off at certain times throughout the year, and it's just not enough to keep up with the demand that's always growing. But then on top of that, thinking about, hey, I'm a dentist here, I'm training people, and it's a lot to bear, it's a lot to shoulder. I can't even imagine kicking off a program that matches up with everything that Dan B needs, whatever your state requirements are. And then a lot of people are bringing in new hires that they're noticing, hey, this person doesn't demonstrate the skills and competencies that are required. Some states, like I'm out of Utah, we don't have requirements like that in Utah, so you could hire anybody. And after 2 weeks, the patients, people notice it's not the same kind of training that they thought they were going to get when they get hired into a role like that. So we really want to standardize the training. We want to have something that you can deploy anywhere with any health center. That's the idea behind the Career Step course. If we kick over to the next slide here, Career Step, it was started in '92, I believe. We're an industry leader for FQHC training. So even before Kansas, which, Chessa and I have been working together for a long time, but even before that, we had kicked off partnerships with, the PCAs in Michigan and Pennsylvania and Massachusetts and all these different states. And we'd kind of kick this off as standalone training in most of those places. So healthcare apprenticeships are obviously a new idea. Like Lindsay was saying, it's kind of the new wave, and this is the way that people should be moving forward. It's full of all the best practices to grow your own. But our programs are set up so employers can kick it off however they want, but we can line up with the national certification requirements. It's a very interactive program, even though it is online and self-paced. It's set up so we can make the job feel like they're doing it instead of just reading about it. We include lab kits and real life scenarios, and we'll show some screenshots here. I know we're tight on time, but we'll kick through that. We've got instructors for each of our programs that work in the field. Obviously today talking about the dental assisting program. Our head instructor for that program is a registered dental hygienist. She lives out on a ranch in Idaho, I believe. And anytime learners need help or have questions, they can click on her schedule and just carve out one-on-one time for like a tutoring session if they ever needed it. If we'll go over to the next slide. With the training program, this is kind of a flow chart starting up top left of the modules of the program, then moving through, if you can see that skinny little arrow there. But we start everyone off at square one. So they don't even need to know what a dental assistant does when they log into this program. We start them at the very beginning and build them up from there. And that way anyone from any walk of life can do it. Obviously, if you have a rock star, if you've got somebody that's already been working as a dental assistant, they've got some of those clinical skills already, but they want to get certified and they want to build their skills even further, you can put them in this program, and since it is self-paced, they're probably going to fly through it. So you do have some of those superstars that already know some of this stuff that can get through it a little bit faster, but for the most part, it's just built so anybody can do the course. Next slide. Okay, so just some screenshots of the training program here. I touched on this earlier. We want to make it feel like they're doing the job or like they can see and do this stuff instead of just reading about it. So we've got 3D models and animations that are going to help learners better visualize and understand some of these topics. And you can see here, they've got to place the HVE for the maxillary right quadrant. They've got to go through and click the right stuff, click and drag. The next slide here, I think, shows the dental tray simulations. And I feel just terrible for these models that signed up for this job. Not the best modeling profile pictures, but it does give you an idea. Like, you'll click and drag the equipment and move it around. Down on that right side is a pretty cool one. It's the dental tray root canal treatment. So they'll go through and line up the tools on the tray in the order that the dentist is going to need them based on the procedure that they're seeing on their screen. Next one. Okay, so dental lab kits. We've partnered with some really cool vendors for the program. So obviously we've got some really cool stuff that makes it feel like they're doing the job, but we also want to get them as many things in their hands as we can. So we provide a dental kit for each of the learners. Obviously, if you have stuff already on site, that's great. This is just something that's included with our course to give them some extra hands-on practice there. And then the next slide. Data and reporting, and this is a big part. So with apprenticeships, I mean, career step, we line up really well with FQHCs because we've got, you know, some of those programs: medical assistant, dental assistant, pharmacy tech, coding and billing, and those are some of the problem areas for hiring. But if you wanted to kick off an apprenticeship, you're not required to go with career step. You could go with your community college program. You could go with whatever's local to you, or really any program that's out there. We just line up with FQHCs. One of the things that we were getting asked about a lot is like, you know, hey, we've done a program before and we had to wait for report cards every few months and we didn't really know where people were at. So we partnered with Tableau, and they have a really cool partner performance dashboard that we built in. So you can log in and see where your learners are at any point in their program. If you're doing apprenticeship or just standalone training, you can log in and see, you know, how much they've studied in the past week and what their scores have been. And like, you know, if they got hung up on a certain section, you can help them out. We also give the preceptor like an unlocked version of the account, so they can kind of float around stuff too. If somebody comes to them with a question, they can just skip ahead to that module and pull it up and see what they're seeing. Another big part of this is the partner success manager. That's who, you know, the Primary Care Association works with really closely in the Community Care Network of Kansas case. But we kick off these apprenticeships with just an individual FQHC too. So we can assign you a partner success manager that's working with all these other FQHCs and PCAs that have kicked off programs already, and they can kind of share those best practices with you as well. I know the one that's assigned to the Community Care Network of Kansas, Jen McCracken, she's like, you know, if you want to know what you need to do, you've got to hire a Lindsay. That's the best thing that you can implement, but really they could share what everybody else is doing and what they've had success with, and all sorts of different things there. So they send out these reports, they schedule check-ins with you, they keep up on this stuff to make sure that people are completing their program and not just enrolling, along with all the other layers of support that come with a good apprenticeship program. And then next slide here. So we provide career development programs. All the content's going to be aligned to industry credentials, and it's really just set up individually with each FQHC. So you can reach out to me. I think I got contact information on the next slide here. Yep, down at the bottom there. And you can reach out to really any of us if you've got questions. But if you wanted to go over how to kind of tailor this to your FQHC or to your state or to your PCA, reach out and we can kind of set up a session just to go over your specific requirements. And a lot of times the biggest hurdle is the funding. There's all sorts of different funding out there with your state, with your apprenticeship office, that we can kind of tap into. So it's case by case, but if you want to shoot me an email, we can get something scheduled and kind of customize it to you folks too.
Fantastic. Well, thank you all so much for sharing. It was such an incredible presentation with lots of key takeaways, inspiring stories, and all the wonderful resources. We don't have any questions left in the chat. We answered them all, but I know you're getting a lot of love in the chat. Is there any other final comments that any of you would like to make before we dive into our closing remarks?
I would just like to say that, I know dental workforce is a struggle for all of us. And I'd almost like to put out the back call. If, of course, I'll connect with Candace, but, I think there's a big wave of change that needs to happen. And I think registered apprenticeships is one of the answers. But if there's others and you guys are doing amazing things in the dental workforce space, I would particularly love a bit of your time to learn more about that. So.
Fantastic. Well, thank you to all our presenters on this session. We so appreciate your time and dedication to spreading this knowledge. So thank you all. Awesome. From here, we're going to dive into our closing remarks. Just going to go ahead and Chessam's going to stop your video. Perfect. Awesome. So I just want to go ahead and share as we're closing out our day. I want to share that word cloud that we've been sending out in chat and during the breaks, because I'm sure you're all interested in knowing the results from that word cloud. So we had lots of wonderful responses, with the most prominent word being networking and learning and innovation, which I think is so descriptive of what this Workforce Summit is all about. I know we all wish we could be in one big room together today, but the virtual space allows us to really dedicate this time during our busy work days to join this session, learn some best practices and innovations, and also meet colleagues from across the nation who may have not been able to travel to the location of the conference. So again, thank you all for taking the time to complete this. I think it's a wonderful representation of the goal for the Workforce Summit. With that, I'm going to go ahead and share our Day 2 overview, and I'll pop that in the chat as well. So the full agenda can be found at the link in the chat. But for tomorrow, we'll be having sessions focus on leadership and mid-level management training. That presentation will also come with a breakout group. So again, same process as today, where you'll go to a different Zoom meeting. The breakout group for tomorrow will be 30 minutes, so you'll have plenty of time to connect with those in your breakout group. And again, really encouraging you all to participate in those and sharing your contact information with the folks in your breakout group. After that, we'll have a break, and then we'll dive into a session on navigating and enhancing effective intergenerational communication. We'll wrap up Day 2 with a panel presentation on building training programs in health centers, followed by a session on strengthening emergency preparedness for the community within health centers. And then again, our closing remarks for Day 2. A few housekeeping items that I wanted to point out. Everyone will be receiving the slides and recording for Day 1 as well as Day 2 in about a week or so following the Workforce Summit. That will be sent out to anyone that has registered. So please be on the outlook for that. And again, should be within about a week. With that, I'm also going to launch our day one workforce summit evaluation. So if you could all complete that, that will be comprehensive of the entire day one experience of how it went. Again, for tomorrow, we welcome flexibility. So join us when you can, as your schedule allows and as it permits. You are welcome to join whenever you would like. So you can leave, you can rejoin, you can really be flexible with your schedule, because we know it's really hard to get away from emails and other meetings for 5 hours. And then I just want to provide, again, a thank you to our advisory group, our planning team, and all the speakers that we've had today for your dedication and your commitment to sharing those innovations and best practices and really contributing to this robust agenda that we have for this year's Workforce Summit. I also want to provide a thank you to our federal partners at HRSA for providing the funding for this opportunity, which makes it a fully free Workforce Summit to all attendees, which is so fantastic that we're able to offer this to all of you. And then a thank you to all of you that take the time to join us for this Workforce Summit. Again, we know it's 2 long days, but hopefully you're able to get those tangible nuggets that you're able to implement at your own health center and at your organization. So thank you again for attending and for your engagement with our presenters. If you do have any questions, feel free to put them in the chat and I can try to answer them before we log off for today. But hope to see you all again tomorrow at 12 p.m. Eastern, 9 a.m. Pacific, and have a great rest of your day. Thank you.
Thank you, Megan, for day one.
You're welcome, Katja. Thank you. Okay, bye.
Bye, and bye, ACU.